It's 10 o'clock. Are we ready?
I think you're ready to go.
Okay. As the Division III Finance Chair, we started this meeting at 9:30 and we went into recess till now. So I'll go ahead and read the checklist. And I want to apologize to any participants who got in at 9:30 expecting us to get started, but hopefully you're in for a good show at this point. The checklist, as chair of Division III of the House Finance Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 as extended, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I'm confirming several things. A, that we are providing public access to the meeting by telephone, with additional access possibilities by video and/or electronic means. We are utilizing Zoom video webinar for this remote meeting. All members of the committee and the staff at state agencies with agenda items have the ability to communicate contemporaneously during this meeting through this platform. And the public has access to contemporaneously watch and/or listen to the meeting on Zoom or phone following the directions and links provided in the House calendar. That's House Calendar 8 with the instructions. It's on the Gen Court website. B, that we will be providing public notice of the necessary information for accessing this meeting. We previously gave notice to the public of the necessary information for accessing the meeting telephonically. Instructions have been provided in House Calendar. And earlier I said it was House Calendar 8, but it's actually been every calendar since then to include 12, which was the most recent. C, providing a mechanism for the public to alert us, this public body, during the meeting if there are problems with access. If anyone has a problem, please email LBA_fiscal, FISCAL, at leg.state.nh.us. D, adjourning the meeting if the public is unable to access the meeting. In the event that the public is not able to access this meeting, we will adjourn and reschedule. I don't expect any votes today, but if we do take votes, they'll all be taken on an electronic roll call. We'll start by taking a roll call attendance. And I would just point out that Representative Nordgren let me know that she had a good reason for being late this morning. So although she's not here with us now, she's with us in spirit. So, Mr. Clerk, would you take the roll?
Representative Irf.
Present and alone in my office.
Representative Weiler, I'm President Kingston, alone in this room. Representative Bean.
President, and I'm in Guilford, and my wife is wandering around here and there.
Representative Wallner.
Present, and I am in my home in Concord, and I'm alone in my house.
Representative Nordgren is expected late. Representative Rogers.
I'm present in Concord in my apartment, here with my dog Romeo.
Representative Edwards.
Representative Edwards, I'm in my home office in Auburn. My family's in the house, but my door is shut. I don't think they're coming in.
We have a quorum.
Thank you, Mr. Clerk. Before we get started, I would like to thank Representative Rogers for her interaction with the committee last week. We were going over one of the budgets, and we were dealing with rents. I believe it was in the management area. And Representative Rogers remembered a historical conversation that had been had on the rents in the Rochester office. And I was unaware of it. I don't know the committee's history. So I just wanted to thank her for two reasons. One, for being willing to open up and ask questions. And two, if a question or information is of a historical note, that's particularly important to me because I don't have your shared history. So thank you, Representative Rogers. All right, so I think I want to do one more thing before getting started. Representative Earth asked me last week what numbers I was citing when I would say things like, that line looks like it's up 32%. And for the committee members, since you have this Excel sheet, there are 4 columns on the right of the Excel sheet of the governor's budget. And basically, I just did a really simple indicator. It's not meant to be real math. It's just meant to be a tool to highlight line items, where I took the FY actual and the FY adjusted, added them together and divided by 2 to get kind of a base. From there, I took the governor's recommended budget for 22 and 23, added them together and divided by 2 to get a projection. So then I took the projection minus the base just to get a delta, and then I did a percentage on that delta. And I know that there are at least 5 things wrong with doing that if this were real math, but the only reason I'm doing that is to give me sort of a visual flag on which line items seem to be out of ordinary or worth further explanation. So I hope that that is clear to everyone that was curious where I was pulling these numbers. All right, well, are there any comments from the committee before we get started? I think our first person up today is from the Division of Program Quality and Integrity, but I want to check in with everyone before we get started. Representative Weiler, you're recognized.
Thank you, Mr. Chairman. I heard a comment, and I put it in the minutes, that the general fund was up 45% in HHS. Now, maybe Mr. Ripple would know, was that one particular area, or is it the whole HHS is up 45% in general funds? If it is, that's a shock.
Well, I don't believe the general funds are up 45% compared to the 21 budget. That number might have come from 20 actuals versus the 22 budget, but I'm not sure. I'd have to take a look.
Thank you.
Okay, so let's have a quick conversation about that. Representative Weiler did a really great job. I was sort of surprised at the thoroughness of the notes that he took, just because he's so busy. But so he sent them to me. I made some very minor modifications. I sent them to Representative Earth. What's the standard way that we go ahead? Representative Nordgren, thank you for joining us. What's the standard way in which we circulate the minutes before we vote, and do we vote on those minutes in order to make them official? I kind of need a class about minute management. Do you want to say what you think, Representative Wallner or Representative Nordgren? What do you guys think? Go ahead, Representative Wallner, you're recognized.
I don't think in the past we have taken votes on minutes, but I do believe in the last, and Kathy can correct me if I'm wrong, I believe in the last session, Kathy was the clerk on Division 3, and she distributed her minutes to all members. And obviously they were put on file with the work notes of the division. But I don't think we ever actually voted on them.
Okay, so to paraphrase, it sounds like they're more working notes than they are official minutes. Is that fair?
What I would do last time is I would send out the minutes, 15 minutes. I took them on my computer and I would send them out between 15 minutes and half an hour after we ended our session to all the members of the division. And any corrections anybody have, I'd make and send them out the next day with the corrections. So everybody had them so they could look at them that night to see, refresh their memory of what we went over. So they were working minutes. I mean, I had a habit from law school days, I could do pretty much transcriptual minutes, and they just went out. Ken's seen my minutes before, and I would send them out that day so that people had a working knowledge and memory of what went on that day. So they had it for the next day, and they were working minutes, and I sent them to Janet as well to put in the record.
So thank you for that. And I noticed you didn't volunteer to be the clerk this term, but I'll put that aside for now.
No, it's very hard work to be the clerk. So I used to be blackmailed into being the clerk in the past.
Yeah. So I have nothing on you apparently. Okay, so Mr. If you could.
The Finance Committee, we've never had a real formal process. It's whatever the clerk and the chair of the division can come up with. And most of the time, I would turn in handwritten minutes to Janet. She'd put them in the file, and she'll say, I'll type them out come a break in the summer or fall. But they were rarely ever typed out. I'm trying to do that this time. Kathy has led the way here, but I can't do transcriptions like she can. But I try to get as much as I can in detail, especially answering to questions, because it'll come up later. Didn't we ask that question? What was the answer? And a lot of the times we don't get an answer. We'll try.
So I think technically I'm going to consider the notes to be working notes and not official minutes, and that we'll put them into the committee record. And Mr. Ripple, if you find out that that's the wrong category, let me know.
Okay.
We'll just try to figure out the process. All right. Are there any other questions before we get started, or comments from anyone? Okay, I think we're going to have the Division of Program Quality and Integrity up first. Meredith Tellis, I think is her pronunciation. And then we'll go ahead all the way through the slide deck, and then we'll go into the relevant accounting documents so that we go from top to bottom without interruption. And then we'll have IS later. And I'm kind of hoping to finish by about 2 o'clock, 2:05. There's a hearing at 2:15 that I'd like to testify on. So we'll try to maintain a little pace. And I got some feedback that 20 minutes wasn't enough for lunch last time. So we'll go to 25 minutes this time. All right. So Mr. Ripple, if you want to bring Ms. Tillis in. And
yep, I think everybody's in.
Okay, very good. I'm going to go on mute. Everyone
Kevin,
should
do you mind? Kevin, do you mind also just bringing over Beth Kelly as well?
Sure.
Thank you. And just a request, Chair, if you don't mind, with the notes from the committee, if you're willing to provide them to me as well. Representative Rogers did last session, and that was very helpful to make sure that I was hitting all the follow-up questions as well.
I think that's a very fair request, and we'll honor it. I think that with this first set of minutes, we're just trying to, figure out what our process is, and it'll get smoother and quicker, I believe.
I very much appreciate that. Thank you. So I'm going to go ahead and turn it right over to Meredith.
Good morning, Mr. Chair and members of the committee. I'm Meredith Telus. I'm the Division Director for the Division of Program Quality and Integrity. And I apologize. I was in the middle of rejoining when I think you were saying something about the slide deck. Can I bring it up and share it, Kevin? Do I just bring it up and share it myself?
Yeah, you should be able to.
Okay, great. Do that now. Everyone can see this? I hope if I can get a thumbs
Yes.
up or something. Thank you. Okay. Perfect. So let me try to go to, sorry, I want to do full screen. I can do that. So as I said, my name is Meredith Tellus. I am the Division Director for the Division of Program Quality and Integrity. And I'm gonna start just by looking at the agenda with you folks, let you know what we're gonna go over today. So first, just an overview of the division, and then we'll have a conversation about the bureaus that make up the division and each of those bureaus' key functions, key partners, the accomplishments, key challenges, financial summary information. And then last, I have a discussion of the department audits. There had been a question about audits that the department has been subjected to, and I have some information on that. A lot of audit highlights for you folks. The division is relatively new. We were technically created by executive order in 2019 to be responsible for the items that you see listed here. These are actually bullet points from our executive order. So outcomes, performance measures and accountability, strategic and operational planning, data reporting and analysis, business process analysis, project management and implementation, internal audit, and enterprise risk management. That was in the spring of 2019, the executive order was issued, and over the summer and fall of 2019, the department leadership really did some consideration of what work is engaged here and what would make sense for organization of this division. And so it was really in late 2019, we were kind of fully incorporated and pulled together 2 existing bureaus within the department with the hopes of continuing each of those bureaus' current functions, as well as eventually being able to offer kind of new functionality within the department. So the 2 bureaus that really had a nexus to the intended work of the division were the Bureau of Program Quality and the Bureau of Program Integrity. And I've listed here their former names. We've just changed our name relatively recently because you may see them referenced this way in the budget document itself. It may show up in the briefing book or other documentation that you see. So I want you to be able to recognize both versions. The Bureau of Quality Assurance and Improvement is now the Bureau of Program Quality, and the prior Bureau of Improvement and Integrity is now the Bureau of Program Integrity. The names are just simpler, clearer, and fit well with what these bureaus actually do. I'll stop there for just a minute and see, yes, questions.
Okay, so administratively, I'm trying not to interrupt you in mid-sentence, so I'll wave at you if we've got a question to ask you. Okay?
That would be great.
Okay, so my question on this is that I'm aware that there are several efforts to take good executive orders and to craft amendments to put them into bills so that we can turn this into legislation. So that I know that that's generally occurring. Do you know if anyone is specifically working on formal legislation for your department so that you have statutory authority going forward?
No, I don't believe that's the case.
So technically, is it true then that if state of emergency were to end tomorrow and the executive order was to go away, your department would have no authority to continue?
It's not the case. Thank goodness for me and for us. It's not, we weren't created by one of the emergency orders. We were created by an executive order. So that will continue to stand because this executive order was created prior to the state of emergency.
Oh, okay.
And executive orders stand beyond a single governor as well. So this executive order would continue in perpetuity unless it was fully rescinded at some point.
Okay. So Ms. Rounds, if you could help us, I'd like to see if we can figure out if there's a legislator who's working on legislation to shift this from being an executive order to legislation. It just seems to me like for the employees of this division, it would be a little unsettling not to have permanent standing.
Okay, yes, I can pass that on to John Williams. To my knowledge, I think as Meredith stated, there is not anything currently in legislation planned for
And
legislation.
Representative Waller has a question. So thank you for your answer, Ms. Rounds. Go ahead, Representative Waller.
Thank you. Meredith, as you go through your presentation, can you let us know if there are areas of your division that have corresponding sections in House Bill 2? Or if you don't, I think last week someone said they hadn't seen House Bill 2. We have it in a draft, but if there were things that you requested that you wanted in House Bill 2, and then we'll have a check on whether they're there or not.
I appreciate the question. Thank you, Representative Wallner. I have not seen House Bill 2 either, but I don't anticipate there are any specific, and Karen, maybe you can chime in on this too. I don't believe there are any specific items related to this division that would be in House Bill 2.
I don't believe so.
I don't think so. Yep. If and when I do see it, if I think of anything, I will certainly let you know.
Okay, there was one section that particularly jumped out at me, and maybe it's in the wrong, I'm asking at the wrong time, but in section 38 of the draft House Bill, who knows what section will be when it's finalized, but there is $10 million for to follow up on a report done by Alvarez, and it's about certain agency operations resulting in greater efficiencies and accountability.
Yeah.
I didn't know whether that would be in your department, if that's in your area or not.
Thank you. Yes, I hear what you're talking about. That is really, I believe, across the department. Karen, I'm looking for you to nod or shake your, yes, she's nodding. That is, it would tie with my division, but not my division alone. So the follow-up to that report is going to really land across the division in multiple areas.
Okay, so maybe I can follow up with Karen, or Karen could follow up with us about that report. Okay, thank you.
Absolutely. I think that language, could be discussed independently, put it that way.
So since we're going to be breaking brush on the spreadsheet later, Ms. Rounds, if you could draw our attention to the line items that would address Representative Wallner's question, that'd be great.
Yes, that
spread out over multiple departments at this point.
we could talk. Yes, we can talk about that later. Yes.
Right. Thank you. Thank you for taking all those questions. I hope we
thank you, and thank you, Representative. I appreciate the idea of giving it more continuity by putting it in legislation. That would be welcome. I do want to point out what you see here for our general responsibilities, the things listed here as far as identifying outcomes and performance measures and accountabilities and strategic planning and auditing and risk management. Those are all important functions, and I don't want anyone to think that the department wasn't engaged in those functions prior to the establishment of this division. Of course, every program area across the division is engaged in this kind of work in one way or another. But I think the establishment of the division was really a recognition that it's not necessarily their area of expertise. Each of the program areas are experts in their program areas, so their populations, their provider networks, national best practices. There's a lot of things that they're engaged in at the same time that they're trying to do this kind of work. And so the establishment of the division was a way of kind of trying to centralize expertise in these areas so that we can partner with the program areas and they can get on with their day jobs while being able to rely on us to build some of these skills and practices and help them better achieve their goals. So I just wanted to point that out to everyone. And here is a slide with our contact information. So myself, Division Director, and then Tasha Blanchard is our Bureau Administrator for the Bureau of Program Integrity, and Susan Drown is our Bureau Administrator for the Bureau of Program Quality. And they're both on this call today for when you ask me difficult questions. You can call any of us at any time and we'll work together to get you an answer for any questions you have as well. This is our mission statement, and I'm not going to read it to you, but I will pause and give you a minute to read it. And you will note we don't have a vision statement.
I'm sorry, I'm a little slow. My question here is under financial integrity. If, for example, and I'm sure it's not happening, but if, for example, we were receiving federal money for program X and we weren't precisely within the scope of X, would this office be the key accountable office for just figuring that out and reporting it?
There are a couple different areas. So every program area and all of the finance managers are also responsible for ensuring compliance, of course. But yes, we do have the internal audit function. So if we are doing a review of that area, we'd be uncovering that kind of thing. We also have a grants administrator who sits within our contracts unit, and she is primarily working on establishing the internal controls that will help each of the program areas and each of the finance managers make sure they're in compliance on a regular basis. So that's one. We also have the internal audit function in our division, and another key function that we perform is we really facilitate audits when auditors come to us, which is why I'm doing the presentation on department-wide audits at the end of this. So for example, our single audit of federal funds is really our biggest audit there, but it's also the case that a federal agency or the OIG could come in and audit a specific area. When there are findings there, our division would work with the program area and the finance managers to say, all right, here are your findings. What are you going to do to fix it? So we're really pushing on the corrective action plans to make sure those things get remediated timely.
So just as a thought, I think LBA does what they consider to be an external audit. And if you're also doing audits, but they're internal in nature, having that in your mission statement may help.
Yep, that's a great point. That's a great point. I appreciate that. Thank you, Representative. Because we are this year, I hope to finalize our mission statement, also develop a vision statement, and then create some kind of key performance measures and goals for our own division. I appreciate the feedback. So I'll start with the Bureau of Program Integrity. When you think program integrity, you can think largely financial integrity and fiscal integrity. These are really the key controls related to cost containment and reductions in overpayments. So you'll see there's 6 units listed here, and I'll go over their functions in detail, but just generally to know, they're really looking at accountability and integrity as related to finance in a few key areas. So the first 2 areas are exclusively related to Medicaid. And you'll notice as I go through, and I think this makes sense to you because it's true of most of OCOM, we don't have, key populations or beneficiaries the way a lot of the programs that you'll be talking to in the coming weeks. We're really serving either another division within the department, a program area within the department, or one of our federal partners. So in this case, these 2 units are serving Medicaid so that we're in compliance with some CMS regulations. And the first is the Medicaid Program Integrity Unit. So this unit, yes, has basically the same name as the Bureau, but that's because federally they're referred to as Program Integrity. So it's the same name. Medicaid Program Integrity is focused on providers, Medicaid providers. So they're responsible for prevention, detection, and recovery of fraud, waste, and abuse for Medicaid providers. Most of what we find is waste or abuse. I don't want anyone to think there's rampant fraud, but we do a lot of provider education, and we do that in partnership with the individual program areas. So let's say it's like a dental provider. We would work with Dr. Finney in the Division of Medicaid Services to educate that provider. It's a lot of provider education, maybe sloppy billing, maybe sloppy documentation. And if it's something we see continuously, we'll talk about doing broader provider trainings for that provider type. Maybe something changed in administrative rules and they didn't catch it. So we do a lot of that. But we do occasionally find instances of suspected fraud, and where there's a credible allegation of fraud, we would then make a referral to the Medicaid Fraud Control Unit at the DOJ. affectionately called Mafuku. And that happens on a regular basis. We make referrals to Mafuku. So and there might have been you might have seen a press release last week or the week before. I think 2 main individuals were arrested based on an investigation that we had started and referred over. And it was for home health. I think we found instances of billing where the individual, the client, was not at home. So they're innocent until proven guilty, but still, that's just an example of the kind of work being done. Representative Edwards?
So specify DOJ, is that the federal or the state?
That's state level, DOJ.
Thank you.
Yep. And I'm just going to say, I can actually only see a few faces. So if other people have questions, they may need to just speak up.
The way it works is they're supposed to ask me and then I ask you.
Okay,
So,
thank you. I can see you. That's all that matters then. So that is Medicaid program. Oh, they are also responsible for provider enrollment. So they have to do the screenings of all of our Medicaid providers upon initial enrollment and then upon revalidation, which is done every 5 years to make sure they're not on any blacklists and they have the proper credentials. Our third-party liability unit, as I'm sure you're all aware, Medicaid is the payer of last resort, which means that anybody who has Medicare or any third-party insurance, we need to make sure that insurance is paying first and then Medicaid pays after. So that means we have to have proper edits up in our system so that we can reject claims that should be, or deny claims that should be covered by another insurance first. And then if for some reason we didn't know about the other insurance and we find out later, then we have to go back and properly bill them or bill the provider and make sure that Medicaid recoups the dollars. So these are both areas, Medicaid program integrity and third-party liability, where the work has really shifted a lot in the last 4 or 5 years. And I have a slide that's gonna kind of show a chart where you'll be able to see that. Because our population has migrated out of fee-for-service, where we are doing the work ourselves, we're doing the review of claims for program integrity, and we're doing the review of other insurances for third-party liability. We're now in a position where we need to do a lot of oversight of our managed care organizations. So that's really shifted the focus of how the staff are engaged. And we had to develop a lot of reporting structures to get the information out of the MCOs, and we have to liaise with the MCOs to make sure they're doing this work to our standards. And simultaneously, we're still actually doing the work for those that remain in the fee-for-service population. And of course, for long-term supports and services, that's all in the fee-for-service population. Any questions on these slides? Are you on? Okay. So then we have 2 units that are largely focused on Medicaid and food nutrition services, so food stamp, the quality assurance unit and special investigations unit. So quality assurance does audits of food stamp eligibility. And this is a really kind of regimented formulaic process because it's all very clearly spelled out in FNS regulations. We have to develop a sample size every month and then audit all of the food stamp eligibility for appropriate income levels and food stamp issuances. And we also look at people who were denied food stamps or terminated. And then we develop reporting that goes to the feds. But we also have a feedback loop back to the Bureau of Family Assistance that actually does the eligibility determinations. And we have a pretty robust conversation with them. That's actually been I would say, developed a lot more in the last year or two under myself and Chris Santinello. We've really partnered, and the group has done an amazing job. They've split into work groups to make sure that we're really getting to the root cause of any errors in eligibility determinations. So was it training? Was it something wrong with the eligibility system, new heights, or documentation? What is it that we need to improve in order to prevent these errors from occurring in the first place? And as you may know, the error rate is then usually submitted to the feds, and then they would develop a national error rate and compare every state to those errors. That process has been suspended for some time, and we actually just got word this morning. I think it's going to continue to be suspended through 2020, fiscal 2020 and 2021. But we are still doing the reviews. Even though the error rate development is suspended, we are still doing the reviews, and we are still going to be working with Bureau of Family Assistance to make those improvements and keep the error rates down. Our Special Investigation Unit investigates and prosecutes client fraud. So that can be in the areas of Medicaid, TANF, or food stamp benefits. But again, the FNS regulations here are by far the most rigorous. So this unit, I have a slide that I'm actually going to show you because this unit experienced some pretty hefty turnover. It's a group of investigators, and they're charged with reviewing any referrals or allegations of fraud for beneficiaries for assistance. We would do an investigation and then recoup overpayments, or establish a claim and just recoup the overpayment. Or if there's an instance of fraud, we actually work with the county attorneys to do prosecutions for those. So in the last 24 to 36 months, there's just been some very high turnover here that's impacted the work. But we have a plan. Everybody's very well trained now. We're hiring a bureau administrator, and have a good plan to bring down the backlog there. There we go. So this is what I wanted to display related to our recovery of overpayments. And what you see here in the TPL recoveries, this is the blue line, you see it going down. But the reason it's going down is because where our managed care organizations are now responsible for doing those recoveries, they are keeping the money. And on our side, we are reducing the amount that we pay the managed care organizations in our PMPM, our per member per month amounts. So I just wanted to display this change, because while we're trying to ensure that we're maximizing our cost avoidance and cost recoveries for third-party liability, that's data metrics that we've had to develop with the MCOs to ensure that we're seeing it in their data, and then we can incorporate it into our PMPM on that side. Fraud, waste, and abuse recoveries you see here, that's for both beneficiary and provider overpayments. So that's both Medicaid, program integrity, and the Special Investigations Unit on both sides.
So I have a question for you here.
Yes.
On that. So as I'm just looking at your organization from a cost benefit analysis, this is obviously a benefit. Would you just summarize the A number for, say, FY 2020 on the amount of the recoveries that actually save general funds money for the taxpayer? Are you able to do that? I don't want to put you on the spot.
Well, no, I just want to make sure I understand the question. So when you say the actual recoveries, yeah. These are total funds. So this would be 50% general funds, approximately. Okay.
So I'm just looking at you and from a very narrow perspective. We're spending money on state employees and rent and all
Yep.
that. And so this is your profit. Okay, you're bringing us back this money.
Right.
I just want to, our cost is you, our profit is X, and I'm wondering what X is.
So you're looking for kind of a net number?
Well, first, just the recovery number. It sounds like you just said 60% of this delta.
50%. So 50% of what you see here for total fraud, waste, and abuse recoveries would be general funds, approximately 50%. I'm looking, Tasha, can you nod if that's about, yeah, that's about right. Yep, 50%.
And what number would you put on that just for any year?
For any year generally, like not just 2020, you mean?
Any of them, just grab a year. I'm just looking for a ballpark annual.
It would approximately be the same. I mean, as you can see here from 2017, 18, 19, and 20.
Is that 500 million? What is the number?
Yep, about 500 million. I'm sorry, 500,000
Okay,
of general funds.
perfect. That's exactly what I was looking for. Thank you.
Yep.
And I do know you have other benefits. This is just one. I don't want to say that this is the thing that's carrying your whole operation, but this
No,
would certainly
absolutely. This,
contribute to it.
yep, this pertains to 2 units in particular, not the entire division. So 2 units are really doing this work. And I will say what we don't see here is the recoveries that the MCO is doing, and then that is being reflected in their data so that we can then pay them a lower amount. So this is just the recoveries related to our fee-for-service population. And it doesn't really include the work that we're doing to partner with the MCOs and say, hey, you're doing this related to fraud, waste, and abuse, but we really need you to be focused on this thing over here. Because there's a lot of kind of management and oversight of the work that they are doing to make sure they're meeting our standards and our expectations of that.
Meredith, can I just add to that quickly? This is also one of the few areas that are not restricted funds, that these funds actually flow through to the general fund. They're unrestricted revenues that are that Ways and Means considers as part of their revenue estimates.
Yeah. So this is a slide showing our beneficiary case reviews. And this is not my favorite information, but I think it's really important to show the committee because we are very, very much a human capital based organization. I mean, across the department, but certainly in this division as well. And this unit experienced huge turnover. We lost, I think, 7 individuals. First, the administrator, and then in another maybe 7 individuals. And they were all replaced except save one person. So you can see how the number of fraud cases established went down, front-end detection cases went down. This was all in the last like 24 to 36 months. The good news is we have a plan to correct this, and we have staff that are very well trained up now, and a plan to kind of bring down our backlog. But I just wanted to show folks how important it is that we can recruit and retain really highly skilled individuals. Was there a question there?
There could have been. Let's keep going though.
Okay. So a couple units, financial compliance unit and our internal audit. These really serve a department-wide population. So the financial compliance unit has one sort of key function related to Medicaid, and that is we audit nursing home cost reports, Medicaid cost reports, to ensure that all the costs in there are allowable, and then we pass that on to the rate setting unit in Medicaid finance for the purposes of setting rates for nursing homes. And then another major component of the financial compliance unit is that they assist in all of our subrecipient monitoring. So this is an area that if anyone has perused the single audit, you'll see that we had findings on this. Other state agencies have findings on this. Agencies across the nation have findings on this. Subrecipient monitoring is really an area that's been beefed up by the auditors' reviews in the last decade or so. And we have in the last 2 to 3 years really developed a robust system to manage our subrecipient monitoring. So we now have protocols that make us look at all of our subrecipients based on risk. So we're looking at, and when I say subrecipient, the difference between a subrecipient and any other contractor that we retain is that a contractor, we may be spending federal funds on it, but they're providing a service to us, to the department. And so we know if that service is provided well or not. A subrecipient is a little bit different. We are giving someone money so that they can go perform a bunch of services in the community for our beneficiaries. They're not performing it for us, so we don't know how well they did it, and hence the monitoring becomes really critical. Both financial monitoring, did they use our money the way they were supposed to use it, and the programmatic monitoring. Did they do what they're supposed to be doing in the terms of the notice of award from the federal grant? So that process has really been developed more. And this unit in particular, our financial compliance unit, works directly with the program areas and the finance managers and the individual program areas on the financial side of that. So to make sure that we do expenditure testing where necessary, we actually audit where necessary, we sample timesheets where necessary, to make sure that the spend matches what they claimed for. Another thing the financial compliance unit is doing is we have centralized our response to the single audit in particular, but they also work with program areas on any federal audit. As I was saying in response to your question at the beginning, Representative Edwards, when we get an audit from the OIG, for example, which we are going through right now related to substance use disorder Medicaid payments, they ask tons of questions, they need a lot of documentation, and we kind of act as a liaison between the program area and the auditors because we speak the auditor language. So when they're saying, oh, we need some kind of documentation for this, sometimes the program areas don't know exactly what it means or what will satisfy them. And we sort of serve as an intermediary to make sure those things get provided. And then, you know, in the case of the single audit, it's similar every year. So it's easier for us to go back to the program areas and say, here's what you provided last year. You need to do something like this is what the auditors are looking for. And the other key function that financial compliance unit has been doing is following up on the corrective action plans for each of these audits. So historically, our single audit was managed within finance, which is fine because the finance managers know all the answers. But the problem is when it comes to the corrective action plan, they also have day jobs that they're trying to manage and be very responsive to the needs of the program areas and department leadership and House Division 3 when they have questions that need responding to within 24 hours. So we moved the responsibility for managing the corrective action plans into the financial compliance unit. And in doing that, we managed to bring down the number of outstanding findings from prior years by many, I mean, maybe a dozen. A lot of outstanding findings have been now mitigated because we just kind of put a spotlight on it and concentrated on it until we could get through to the end. We've also brought down the number of overall findings. And I think that is partly a function of being able to just manage the documentation and know what auditors are looking for. Our internal audit function is relatively new in the last couple of years, and so far has been really doing what I'll call kind of cleanup, and it's just establishing a sense of department internal controls. So for example, managed to pull a work group together to issue guidance, templates, information about policies and procedures across the department and what we expect the department managers to be doing for policies and procedures. This particular function has also been working on reporting requirements across the department. I think John Williams might have discussed that with you last week. And now we are going to embark on our first internal audit for the department, which is very exciting, partly in response to a New Hampshire hospital, recent New Hampshire hospital audit. So we'll be working with New Hampshire Hospital to determine what is best for them to do an internal audit. Another major function of this unit is coordination of LBA audits and ensuring that this is kind of the same as what financial compliance unit is doing for single audits. This unit is doing for all of our LBA audits. So there's an executive order, I think it's 2014-03, that requires us to do corrective action plans and then post on Transparent New Hampshire follow-up to our audit findings every 6 months. Well, the department had been a little bit remiss in doing that, a little bit ad hoc, some were on, some weren't on. So this person ensured that all of those were on Transparent New Hampshire and worked with the individual program areas on corrective actions. And since we started, I think we brought down the number of outstanding findings from like 63 down to just 9 outstanding findings. And we're working to get those 9 remediated as soon as possible. That doesn't count our 3 very recent LBA audits, but all of the prior ones are completed. So we have a slide on key accomplishments. I'm not going to go over every single one of these. They're here for you to read and look at, but I will just highlight the first one that you see here. We worked to establish data interfaces. These are specifically related to Medicaid, to make sure that we are as up to date as possible on Medicaid beneficiaries. So to do that, we had to create these data interfaces with the Department of Corrections, Vital Records, and Department of Defense. And it's either a data interface or it's a report that we receive. And then we take that information and we work very closely with the Bureau of Family Assistance to make sure that in as real time as possible, we're identifying what beneficiaries are or are not eligible for Medicaid. So I know this sounds kind of simple and it probably seems like something that should be totally automated, but I can assure you it is not. And I highlight it here because it's linked to, on my next slide, what you'll see is one of our key challenges. If we don't have real-time data and access to real-time data for which we need a lot of backup data sharing agreements and all kinds of HIPAA compliance things in place, then we're really hindered in being able to do our jobs as quickly as possible. Representative, yes, Edwards.
So I'm aware that on the DOIT strategic plan, somewhere along there, they have an eligibility system upgrade, or maybe it's an entire replacement. Are you aware of that initiative? Are you providing requirements, customer requirements on what you need from that eligibility system?
I'm not aware of that particular upgrade. Where we can, we do work with the eligibility system management and say, is this something we can automate? We'd like to look at automating this type of thing. There are some that we can and some that we can't, but
I'm just focused on the new system for a moment. So are you using the existing system of the last decade, or are you using a relatively new eligibility system?
It's the one system is New Heights, is the eligibility system for New Hampshire. That's the only system.
Okay, you may want to make a note to yourself to just dig into the strategic plan around replacing that eligibility system, because it sounds to me like you have a lot of experience in these feeder reports to figure out what kind of cross checks we need to be doing. And in this new system, that really ought to be bought and configured to service you.
Yes, I very much appreciate the feedback. If there's a new eligibility system in the works, we would definitely want to be able to have a lot of communication around that in this area and in the other work that we're doing related to third-party liability and other things. So thank you for the heads up.
Sure, thank you.
Yep. Key challenges. So as I said, data access is really something we think about and talk about and breathe every day. We need information to be successful in our investigation work. And that means access to data from different agencies, from municipalities, from the counties, from federal databases. We need to be able to assimilate that information and compare it up against each other in order to detect fraud. It's the only way we can do the work. Technology. So software and contracts for technology necessary to do fraud detection and deterrence. This is an area we don't have a budget ask particularly to do any technology enhancements, but we did just get responses to a request for information for a data analytics fraud detection system. And I think we got 25 responses. So we are in the process of sorting through those and trying to get a sense of what it would look like and what the cost would be. But that's sort of an in progress item right now. And recruitment. As I noted before, it's really imperative that we find highly skilled staff and managers. And we do have a pretty significant vacancy rate in the Bureau of Program Integrity right now. But with the recent executive order lifting the hiring freeze, we have plans to remedy that, of course. So that is the Bureau of Program Integrity. Oh, you'll see the old name up here because this was prepared by finance. So it says Bureau of Improvement and Integrity Staffing, but it's Bureau of Program Integrity. And this is our accounting unit, 7935, 64 positions. This is our budget comparison chart. You'll see we're now at about 50-50 general federal funds.
So does it help receiving federal funds by having an identified structure to do these programs?
Yes, so the federal funds we receive are because the work that we're doing is actually federally required for the program areas. So Medicaid, for example, we're required to do third-party liability. We're required to do program integrity. So they fund our units the same way they fund those units. I mean, very, very similar funding, I'll say. It's about 50-50.
Thank you.
Yep. And this is just information about where you can find the unit in the budget book and on the budget, in your budget briefing book and the budget book itself.
So Chair, this is where I would ask, do you, so there are 2 accounting units related to Meredith's Bureau, this one, and then another one that she's about to go over, that second bureau now. Do you want to wait to look at both accounting units at the end of her total presentation? Or do you want to look at this one now and look at the other one later?
So she just finished a presentation. If there is one set of accounts that address or are consistent with what she just did, let's do them now. It's top to bottom. And then if there's a second presentation, we'll look at the second set of accounts with that.
Okay. So Meredith, if you want to stop sharing, I'll go ahead and share the.
Okay.
Can I ask a question about her last comment before we go to the numbers?
You're recognized.
You mentioned your head count was 64, but the budget shows 69 or 68. Is there a reason that there's a discrepancy there?
I'm not 100% sure because I did get that position count from finance as well. The only thing I can think is that one of them might have been somewhat delayed and counting a handful of positions. I would have expected it to be about 6 or 7, so it's not as many as I would have thought, but a handful of positions that we had in the last biennium doing the function of parental reimbursement. So that was parental reimbursement to DCYF, and that function was discontinued, and so we no longer have those positions.
Okay, but they're budgeted for the next biennium.
I believe
I
the
don't know if those are,
positions
but the numbers
exist,
are.
but I believe the positions exist, but they're not funded.
Okay.
We didn't abolish them.
So as I'm looking at, well, I'm jumping ahead. I'll let you take us through the budget.
Chairman Edwards.
Representative Wallner also has her hand raised.
Yeah, I'm back about 3 or 4 pages into the, yeah.
You're recognized. I'm sorry I didn't see you sooner. I'm like playing with my spreadsheet too. So please go ahead.
Well, I think maybe we've stumbled upon that answer before I got recognized. But so you, Meredith, you have a 25% vacancy rate out
Right
of the
now,
64,
yes.
out of the 64 positions.
Yep.
Is that right? Can you tell me what kinds of people, what kinds of positions are these and how difficult are they to find?
Some of the work that we do is very trainable. I mean, all work is trainable to some degree, right? But I think that you know, the work in special investigations unit, for example, we can train people to be investigators. I mean, if they sort of come with some skills and some understanding, it helps if they have understanding of program area, but we can sort of train them into that. But there are other things like third-party liability, for example, where we need people who can manage a contract with a massive managed care organization and hold that managed care organization accountable to all of our contract requirements and everything that we intend to see them doing within the contract, and understand what it is that we expect in third-party liability. It's a sophisticated skill set, and it is not, someone needs to come with a certain degree of skills that we can't necessarily train them into. So it really depends on the function, I guess, unfortunately, is my answer. But in some places, it's possible to, you know, post the position and you get applicants who are gonna fit that without a problem. And in some areas, it's actually more challenging.
Could I have a follow-up?
Yes, ma'am.
So I guess one question I would have, and I think this is a question I have throughout, sort of throughout the budget, and when we know that we're 20 to 25%, our workforce is down 20 to 25%. Are our wages in this area? I mean, you just talked about these are pretty specialized people. Are our wages in this area competitive with, I assume it would be private industry that we would be competing with? Are we within a competitive area?
I don't know, because I don't know what the wages are in every instance in a competitive private area. So I can't really answer that. I can't confirm or deny, unfortunately, Representative Wallner, but I can say that in a couple instances, we have just now the hiring freeze was lifted. We posted a few positions and we received very few applicants. So that's it's concerning to me, certainly.
Yeah.
And you have to think that wages have something to do with that.
Thank
Do you
you.
have no
Thank you.
follow-up?
No, that was a couple of pages back, but anyway, let's go forward. And what is the number of the page that we're going to now in the budget?
On the spreadsheet, it's line item 13,750.
We're on the this teal highlight, if you will. The first accounting unit that Meredith just reviewed was 7935, which is on page 1168.
Thank you.
So you were asking questions in the area I almost asked a question, and that is, I assume that of the people who have left, I think you said something like 7 people left, and you had almost a complete turnover except for one person. Are you doing? What are you finding from your exit interview process? What are they telling you about why they're leaving, and why didn't that one person leave?
That's a great question. I'm not sure I can answer why the one person didn't leave. Tasha, you may have some insight there.
It's mostly, I want to focus on the exit interview.
Yep.
So in a case of 3 of them, they retired. So they left government service. The other ones that left, or a couple that left, went for advancement in other areas, because the investigative unit is very limited in its upward mobility. It's from investigator. We tried to put in some layers, but it's investigator to a supervisor to an administrator. So there's not as wide of an advancement as there would be in other areas of the department.
Thank you. Who's going to talk to the?
So Did that answer your question?
Yes, 3 retired and 3 needed promotion.
Great. So accounting unit 7935 starts at the bottom of page 1168 and goes on to page 1169. And of course, open to any questions. We did reduce this budget.
Question,
Yes.
Yes, sir.
why aren't we seeing these reductions from the hiring freeze in the adjusted authorized lines for class 10?
It doesn't, the hiring freeze doesn't reduce the appropriation, it increases the lapse for the year. So the budget remains the same under a hiring freeze. There hasn't been a reduction in the budget.
So it'll show up in the lapse, but it doesn't show up on the adjusted authorized at this point.
Correct.
Thank you.
You're welcome.
So to follow up on that, does that mean that the FY22 governor's recommendation is budgeting part of the lapse since it's significantly lower than the FY21?
No, I believe that because of those retirements, this is one of those things we spoke to last week. Often when people retire, they're at the very top of the pay scale. And when a position is vacant, it is budgeted at the very bottom of the pay scale. So other than a one position change, and there may be some unfunded positions in this area as well that may be affecting that number, but probably the largest effect are those for retirements and those now being budgeted at the bottom of the pay scale.
All right, so you're still budgeting for the same number of FTEs. You're just assuming a different average salary.
I believe so, yes.
Okay. All right, so this budget is really all about the people. There's not a lot of other money going on here.
That's correct. You see, it's the positions and benefits lines.
Why is no rent budgeted?
Beth, where would the cost for where these people sit be budgeted? Is that in the larger OCOM budget?
Okay.
Yes, thank you. The copiers used to be in this line and they're now paid for out of OCOM, budgeted out of OCOM.
All right. Well, does anyone have any questions about these line items? Because I do not.
I just have one. It kind of applies to other places. I think I've seen this. The fringe benefits, it looks like they're up, like I think 25% between this spending and the next. But I don't see a matching amount going up in the salaries. I'm just wondering why would there be a difference there, a percentage difference?
So the fringe benefits are set by Department of Administrative Services. And they tell us what those numbers have to be budgeted at. So I can get from you from Department of Administrative Services how they tell us we have to calculate that if you'd like.
Oh, so that's not like Social Security, that kind of stuff, fringe benefit or insurance, that sort of thing. It's something else?
Right, those types of things would be included in class 60 benefits. I believe fringe benefits is something else.
Oh, okay. Okay. I'm just curious what it is. That's all. Thanks.
I'll get that information for you. Okay, no, if there's no other questions, I'm going to go ahead and stop sharing and turn it back over.
I have my hand up, I hope. Thank
Go
you.
ahead. Sorry, Ms. Representative Woolen. Go ahead.
Yeah, so I wondered either Meredith or Karen, if you could tell me, is this budget what you requested of the governor? Is this the agency, are you meeting the agency request here? And if you aren't, what are the other, what's missing? And did you have any additional requests that you were asking for?
I don't believe there are any prioritized needs.
We did
here.
not.
Did
We
we
did not have
unfund,
prioritized needs.
did we unfund any of your positions from the agency phase to the governor's phase? Beth,
I don't
maybe-
believe so, with the exception of the parental reimbursement unit.
Karen, there's 6 unfunded positions in the governor's phase.
That's them. Yep. And Beth, I'm gonna have to work with you, and I apologize to the committee. It looks like what we have for our pie charts on slide 15 don't match what's in the budget here, and I'm not sure why. When I looked at them just now, I thought that's really high. That's not my budget's not that high, but I'm not sure what that is. So
So we'll get you new pie charts.
we'll get new pie charts. Yep. They don't quite match.
So back to thank you for that. And back to Representative Walner's question. One of the slides that you had been providing last week was the 5% increment, 5% decrement slide to just give us a quick overview of what you do with more money, what you do with less. That wasn't in Ms. Tellis's slide deck. Is that coming in the next slide deck?
I apologize, Mr. Chair. It's on behalf of the division. So I have it later in the presentation as opposed to for each of the bureaus.
Yeah, no, that it's the reason for that question is to anticipate Representative Woolner and others wanting to just know what a change in these budget requests would do to you. So.
Yep. And I can go over that by division. And if we need to split it up by bureau, I can do that too.
All right, I'll defer to Mr. Ripple and Ms. Rounds on how to best communicate that to us.
I think
All
that
right.
division is okay.
Next presentation. Thank you so much.
So, all right, Meredith, back to you on the second part of your presentation.
Okay. Now I have to share again. Bear with me. This is where we were. And now we will be. Okay, this is where we left off, I believe. Discussing the Bureau of Program Quality. So Bureau of Program Quality.
Yeah, I want to have the spreadsheet up at the same time. Could you go to your last slide so I know which fund we're going to be talking about?
That was page 1168, looks like. Accounting unit 7935.
We just finished that, didn't we?
Oh, I apologize. So, and you want to look at program quality?
The one you're about to start talking about, DPQ.
And that is, I'm going to have to go to the end. I apologize, but I can find it for you. Getting a preview of all the slides.
Chair, do you want to wait to look at the other accounting unit until she presents on the area?
I do, but I want to, she's doing the slides. I want to be looking at the spreadsheet. So
It's accounting unit 6637. And I can find the page for you. The page is 1182.
I got it.
Now we'll go backwards through the slides. So Bureau of Program Quality has 4 individual units, and each of those is functions, either one or a combination of functions that are really designed to assist the bureau, the department, the whole department, in meeting its overall objective to improve the design and the quality and the effectiveness of our services. So when you think of the Bureau of Program Quality, you can think data. There's a lot of focus on data and getting our hands on the right data and using the data to tell the story of how much did we provide for services, how well did we provide it, and was anyone better off? So really looking at program quality by evaluating the data and the data integrity first, and then conducting the data analysis to see what the data is telling us. So I'll go into each of the 4 functions kind of in more detail. Starting with our data analytics and reporting unit. So all of our units are important, but only data analytics and reporting got 2 slides because they are doing a lot of the heavy lifting as far as data management and reporting. So just to give you a sense, we get data from a host of places. And in fact, this unit, I'll go to the next slide for a sec. If you can see at the bottom here, data systems oversight, this unit actually manages a handful of data systems itself. But generally, we get data from a host of places through our department billing systems, from national metrics, from surveys and audits that we do ourselves. And then we evaluate that data for accuracy and have to make sure there aren't conflating factors, and then analyze the data for the program, or we help the program analyze the data, or we work with external vendors that might have been retained to do performance analysis for us. So a couple of the key functions you'll see here, for example, our data analytics and reporting works on our behavioral health analytics so that we can do monitoring and analysis of some of the metrics that are required for the state's mental health settlement agreement. Just to give you a flavor of some of the ad hoc reporting that they do, what they're really famous for, at least around here, is when people need to know something about their population, about like demographics or claims or services, maybe some kind of ratio, like what percentage of people got this service this way, or what's the trend in this area. You come to data analytics and reporting. So for example, myself, on behalf of another program, I needed to know about OB services. So New Hampshire is a very rural state, and that impacts how people access services. So I worked with data analytics and reporting to say, how would I figure out where people are getting their prenatal, their labor and delivery, and their postnatal care? And data analytics and reporting is doing that analysis for me and then figuring out how to show it to me in a way that is digestible. Another major function of this unit is, you'll see at the top of this slide here, our Medicaid quality monitoring. And I will show you an example of that. So this unit is managing our Medicaid quality information systems. Publicly facing website. You can, if you haven't yet, I encourage you to visit the website. And they are managing 7,000 individual data points. I just found this out last week. It's pretty incredible, which get rolled into 200 individual measures. And those are used to measure the quality of our managed care organizations. So this one in particular, you can see is just an example, but this is emergency department visits that are potentially treatable in primary care. And if you were to be on the website with this one, you could click on this blue line and it would break out into 3 individual lines showing you the track record of each of our individual managed care organizations. And this example in particular, I noticed just the other day, if you look at Q2 of 2020, you can look at the difference between Q1 and Q2 of 2020. You can see the impact of COVID happening right there. So I find that very interesting. I'm kind of a data geek. So you can see the reduction in emergency room visits right there. And then the next slide I wanted to show you is another sort of critical component of what this unit is doing. This is work that we're doing on the development of an enterprise business intelligence opioid crisis dashboard. So you can see draft written. This is in practice. It's in development. It's not out yet. It's not publicly facing. But this is work that we are doing to identify metrics. And this was done in conjunction with another one of our bureau units, our substance misuse planning and evaluation unit, to really identify the measures that matter related to the opioid crisis. And the work that this unit our data analytics and reporting is engaged in, that's sort of represented here, is they're working to standardize department data and standardize data presentation. So step one is really picking the right data to tell a story. And there's kind of a science behind that, knowing what metrics matter and what metrics don't matter or are proxies or are too far away to really be important. So getting that data standardization across all of our individual program areas in the department is really important so that people like you can see it and know what they're looking at is relevant. And one of the things we've been discussing is moving towards certain frameworks of telling stories. So for example, using social determinants of health would be a way that if we can kind of gear all of our data that direction, then we can start looking at outcomes across our whole populations as opposed to in individual program areas. So the second piece that this unit is moving towards is data visualization. And that is its own very specialized science, but developing our skills in data visualization is really, really important as we move towards better use of dashboards to manage our programs and to provide to you guys, policymakers, to help make policy decisions. So those are kind of two, Mr. Chair, yeah.
So I love visual information. I'm just curious about where the personnel are coming from that are sort of the visual information experts on getting the data and creating the graph. Are they coming from the IS department or are they organic to this bureau?
Susan, this was a partnership between the Bureau of Information Systems and our unit, and I think the Division of Public Health. They were all working together on this. I'm not sure if any one was more responsible for data visualization than any other. Susan, do you know better who was working on that?
So you're accurate, Meredith. It was those departments. So those other divisions, it was public health along with our BIS and data analytics and reporting. And then they also were working with a contractor as well. I believe it was Deloitte.
All right, thank you.
Yep. But to get to your point, Mr. Chair, the data visualization skill set is not one that we have clearly identified within the department. It's one that I would like to develop within our division, however, so that because we sort of partner with all of the areas in their data management, I'd like to also be able to offer the visualization piece as well. But we don't have anyone clearly identified to do that at this time. Luckily, we have a lot of smart people who can do it without trying too hard. But like I said, it's a science in and of itself, and it's a skill that can be developed.
Right, so that would just make me wonder if it belongs in the IS group or in your group, but you'll figure that out.
Yes, and I don't, I think Dave Wieters is on the call. He is probably, yes, he's, okay, writing me as we speak. But yes, we can certainly have that conversation for that question. I would, so far we're leveraging Deloitte, our external vendor, as the data visualization leads. Yeah, in the future, I think it's a skill we should be able to have internally as well. I think it's a very important skill. And I would have this conversation with Dave, but personally, I think it belongs more in our bureau. I think that because, you know, we're really doing the data determination, he's agreeing, he's just texted, he agrees. So, I mean, you know, that's because IT is really managing the systems and how the systems are speaking to each other. And we partner with them on this. We wouldn't do anything in a vacuum, but I do think it's a highly specialized skill to be able to create a dashboard that people can see and in real time use to manage things. And that kind of is linked closer to the data science than it is to the IS science. So. Our Medicaid quality program. So they are responsible for our Medicaid quality strategy, which is a federal requirement. As CMS requires that anyone who engages in managed care as a Medicaid management strategy, we have to tell them in writing once every 3 years how we are going to measure the health of our population that's covered in managed care. So the 200 measures that I was referring to before, this area takes those then from our data analytics and reporting and works with the individual program areas to identify genuine issues. So any trends or outliers that aren't going in the right direction. And in addition to those 200 measures, they also review another 50 different tables and reports for the same thing. They'll work with program areas to highlight things where they say this isn't going the way you want it to. The program area may determine they're not satisfied with the MCO's performance, and then that would trigger a conversation with Henry Littman, our Medicaid director, and probably a kind of a frank conversation with the managed care entity to get it remedied. This unit also manages our, let me just see if I have, no, okay. Also manages our external quality review organization, EQRO, external quality review organization, which is also a CMS requirement that we have that. And that vendor manages the quality of our encounter data, which is like the individual claims data that's coming in from the MCOs. They help to do oversight of the specific performance improvement plans. Each of our MCOs has to have a handful of performance improvement projects that they're working on every year. And this area is the EQRO is kind of managing those, and this area does oversight of that. And we've also identified 10 key areas of performance measures that we're going to focus on with the MCOs this year. I can't remember if we're updating those annually. Susan, the 10 performance indicators we have that are related to access and timeliness and beneficiary experience, are those annually updated?
No, so it's part of the 3-year quality strategy.
Okay, so those are every 3 years. So those 10 indicators are things that we've chosen to focus on, are things like adolescent vaccinations, certain screenings for women, adherence to antipsychotic medications. It's 10 very specific areas that New Hampshire chose to really focus on and drill into. Yes, Chair, this question.
So I just want to understand, when you say New Hampshire has chosen these metrics, there are things like organizations like NCQA promulgating, I think it's HEDIS, HEDIS, I'm not sure. Are you really leveraging national standards programs for quality as opposed to going on your own and sort of creating your own metrics?
We do utilize HEDIS measures for our comparators. And I can't remember off the top of my head, Susan, I might be able to see this, whether all 10 of these fall into HEDIS metrics or not.
All but one
Okay.
is either part of HEDIS or it's part of the core set, the CMS core set of measures.
And then what's the one outlier? Not specifically, but why is there an outlier? Is it because HEDIS didn't match, and so we had to make up our own metric?
No, so what we did is we looked at what the lowest performing measures were that could have the best impact on the health of this population. And we also worked with the Division of Medicaid Services to tie these into their APMs, so their alternative payment methods, as well as the withhold and incentive program.
Okay. Thank you. Representative Weiler has a question. Yes.
Thank you, Mr. Chair. So much of this deals with IT, and normally when we look at a budget, we see that they have, a tie with IT, and that they have given them some money from their budget. And I look at things like going to Deloitte for information that we may have in-house in our own IT section. I wonder how much you are working with IT. Thank you.
So we work very closely with Bureau of Information Systems, and much of our data is stored in a variety of different systems, really, but a lot of it is Medicaid related. And so that would be the MMIS system. And that would actually be in the MMIS, in the Medicaid budget in particular. Some of the other data that we're getting, Representative, is actually subscriptions to data sets. So those come into the department in the form of certain reports, or we might be able to get into someone's external data system, and then we have access to their data, but it's not necessarily a system that we own, but something that we can access through an external vendor.
Thank you.
So yeah, I'm not sure if that answers your question, but there are some systems that the department owns outright. I think the Phoenix system falls into that category. The WITS system, which is one that we manage, the WITS system that we own or manage or lease in one way or another, but not this bureau in isolation. It's work that we're doing on behalf of other bureaus.
Give me one more thing. The acronym you and the chairman were talking, was it HEDIS, EDIS? Give me those.
HEDIS. HEDIS.
HEDIS.
It stands for Healthcare Effectiveness Data and Information Set.
Okay, it's in my list of acronyms somewhere, hopefully.
It probably isn't.
Thanks.
Thank you, Representative. Any other questions I was missing?
So to follow up on Representative Weiler's question a little deeper, as I look at the budget for QAI operations, I don't see transfers to IS. And given how dependent you are, I'm just wondering, do they just budget completely separately from you, and you rely on their services in a team-oriented way where you each pay your own freight, or are you, how is the, I guess I can wait on the answer. I'm just trying to figure out what the money flow is to keep an integrated team there in DHHS.
Meredith, I can jump in there if you'd like.
Okay, thanks, Karen.
So the Bureau of Information Services, which you'll hear from after lunch today, which is headed by Dave Wieters, he oversees the technology for the department in coordination with the Department of Information Technology. So rather than budgeting what we would call class 27 is the transfer to DOIT, I believe. Rather than budgeting that in each of the different areas of the department, we budget it in one place in the Bureau of Information Services budget. So you will see that this afternoon.
Okay, thank you.
That explains it.
Representative Wallner has her hand up.
I think that it's the same answer that Karen just gave, but for instance, the contract with Deloitte would be in information. Where would I see that?
So we do, as Meredith was mentioning, have a few pieces of technology that are budgeted within the divisions that manage them. So most of the Deloitte contract is actually budgeted within the Division of Economic and Housing Stability, which you'll hear from tomorrow in the New Heights system. MMIS is also budgeted separately in the Medicaid budget. So some of those larger systems are accounted for separately, but our transfers to DOIT are within the BIS budget.
Okay, thank you.
So I just wanted to show everyone one of the products that's being made by the Medicaid Quality Unit. This is sort of a healthcare scorecard of sorts to help enrollees determine a managed care plan. And this is actually, it's actually a 2-pager, but you can just see here some of the metrics that you can reach from the URL up at the top. Mara Health Caritas is our newest MCO, so that's not reflected here, but it shows WellSense compared to New Hampshire Healthy Families, so that people can kind of look at these metrics compared to national Medicaid, you can see, and help them determine their own managed care plan. Our unit of substance misuse planning and evaluation. So this unit really works with a number of different partners and is engaged to help identify the kind of metrics we would use for program evaluation and outcomes in the SUD sphere, the substance use disorder sphere. So those are partners like the Division of Public Health, Chief Medical Examiner's Office, our Bureau of Emergency Services, our Bureau of Drug and Alcohol Services, the Governor's Commission. So all kinds of internal and external partners, and looking to identify the indicators that tell us, you know, how many services were provided, how well was that done, and is anyone better off? So it's the kind of outcomes you would probably think of in the SUD sphere. Is there a reduction in ER visits? Are people housed? Are they working? Are families united? Are people employed? But those are kind of, you might think of those in terms of end of the spectrum, like through treatment and recovery. This unit is engaged in identifying indicators and performance metrics through the whole spectrum, all the way into the prevention area. So even in like predictive analytics kind of area, thinking about what are the sorts of indicators that can tell us in advance, what are the components that sort of predispose someone for being at higher risk of substance misuse or abuse. So this unit is really, you know, like I said, partnering with a lot of areas. They worked on that enterprise business intelligence dashboard I was referencing earlier. Yep, Mr. Chair. Oh, you're on mute still. You're on mute, Representative Edwards.
Sorry. So Representative Wallner, your hand is up. Is that from a previous question?
Yes, I'm sorry. I'm sorry.
No problem. I
Didn't get
just recognize it. So I'll go ahead.
Thanks.
I'll ask a question here. So one of my general concerns the last couple of terms is it just seems to me like there's this endless flow of money that's going into drug treatment. And so I keep wondering, are we doing enough on the prevention side? Is this the Bureau with the smart people thinking about what's causing people to begin their substance misuse and what we can do to interdict them before they get started down this bad road?
I can tell you from my recent conversations with Joe Harding, who leads this unit, yes, he is absolutely thinking about this. But I think that Susan, I can see her face. I think she has something she'd like to chime in.
So the subject matter experts in prevention come out of the Bureau of Drug and Alcohol Services, and you'll be hearing from them later on. I believe it's this week. But we partner with them in providing them data to help understand prevalence and consequence of substance misuse, to help them identify regions, areas, gaps in services to really target prevention services upstream.
Thank you. I appreciate it.
Yep. So this unit is trying to define the indicators and identify the data that will appropriately inform the policy on effectiveness of all of the practices for substance misuse. Any other questions on this unit?
I'm not seeing any. Thank you.
Okay. And our health services assessment unit. So I'm kind of going to split them into two major functions. One is the first you see here, Sentinel event reporting and management. So they are responsible for intake of Sentinel event reports and then reviewing those carefully to see whether it does meet our definition of Sentinel event, and then running the review process. And then the other major function of the health services assessment is doing external quality reviews of our providers. And you'll see here some of the providers listed, case management agencies on behalf of the Bureau of Elderly and Adult Services, and for the Bureau of Mental Health Services, quality service reviews for 10 mental health centers, and then also redesignation of our 6 psychiatric inpatient facilities or DRFs, designated receiving facilities. So the health services assessment, it's not that individual program areas aren't doing reviews of their own providers, because they are and they do, but what distinguishes health services assessment, our group, is really the rigor with which we design the reviews. So we're creating tools. It might be a survey, it might be an interview template, it's clinical records reviews that are very rigorous in nature and allow you to compare provider to provider and compare providers across time. That's kind of what distinguishes these reviews. They're pretty intense and very well developed. Yes, Mr. Chair.
So if I wanted to know how many nursing home beds we have in New Hampshire right now, and how many we think we're going to need in 10 years, would this Bureau of Elderly and Adult Services be the responsible agency to answer that question?
Yes, they would.
And do they do active 10-year planning? Because when I talk to the good folks at Rockingham County Nursing Home, they aren't looking at a 10-year plan. I've asked the former director a couple of times. We just spent a bunch of money on renovating that place. It's beautiful, but he has no projected bed count requirement in the out years. So how much real planning is taking place?
So I will tell you, we do have a requirement that's relatively recent. We have only submitted one report so far for a 10-year demographics report. And I'm trying to think of the exact populations it hits. I believe it's Medicaid population, and then I think the DLTSS populations, which would be our waiver populations. So DD, CFI, and then also nursing homes. I think those, I'm going to put it in those 4 categories where we were required to submit a report to the committee. I believe there's a committee on 10-year demographics changes. I would have to look at it, and I can get you that report. Unfortunately, this was pre-COVID. So at this point, it is a little bit outdated, and it's a biennial report. So I think our next submission would be this coming fall.
Well, I'm happy to hear you're doing it. I'm just surprised at the disconnect with the Rockingham County Nursing Home not knowing. So I don't want to belabor it. I just am glad to hear that somebody's thinking 10 years out, and it would be really great if the people involved at the county level knew what the statewide thinking was.
That's truly a great point. Like I said, it's a relatively new process, something we're looking to develop. And I think that the requirements of the legislation mandated that we were going to do the review in conjunction with employment security. So in the first iteration, we were really just focused on figuring out what data we were going to use, and because employment security, of course, has ELMI, so we were trying to utilize their information, but looping in the counties at that level for the nursing home portion of the demographic projections makes a lot of sense.
Thank you.
Yeah, absolutely. So I will just note an email that came through recently into my inbox related to health services assessment, kind of summed up for me what this bureau, the Bureau of Program Quality, does pretty nicely. They were working with, I think it was Elderly and Adult Services on this one in particular, and Elderly and Adult Services had a question on something they were seeing in their data. And once we, Health Services Assessment, drilled in, they realized that the way the data was measured had changed to make it more reliable, to make it so that one person and another person looking at the same thing, they were taking out the judgment, and one person and another person were gonna kind of have the same interpretation and be able to record it the same way. And so they were able to go back to BEAS and say, hey, you need to think about this a different way. Because drilling in to understand those distinctions is just so critical in knowing the story that the data is trying to tell you. And I just share that with you folks because I think it sums up a lot of what this entire bureau is intended to do, is make sure that the data integrity is there, and then on top of that, do the analysis to figure out what's the story behind program evaluations and outcomes at a population health level. So on this bureau, for some reason I can't, oh, there we go. Key accomplishments. Again, I don't want to.
Let me just get a checkpoint with you, because we're getting close to when folks are probably thinking about lunch. So,
Sure.
So for the slide deck, how much more time do you think you need if you're not interrupted?
Probably 10 minutes, or I mean, we're done with this bureau, and then we can look at, I'd say this will take 1 minute to finish, because, you know, the key accomplishments and there are challenges. You'll want to look at the spreadsheet. I can't tell you how long that will take. It's pretty similar to the one you saw before in that it's largely salaries, human capital. And then I did want a minute to go over department audits, and that might take 5 to 10 minutes.
Okay, very good.
So in this unit, yep, there are accomplishments. I don't want to read them to you. I will note the middle one that you see here. We worked very closely with the community mental health centers to improve their work on their performance improvement plans for when we go in and have findings related to the work in the community mental health agreement. And we started encouraging them and sort of doing technical assistance on a plan, do, study, act format for the way that they're going to implement those changes necessary for corrective action. And as a result of that, we saw a 9% improvement on the quality service review scores. So that was something we were very proud of. And for some reason, I can't, oh, there we go. Key challenges, this is similar to what you saw before. One is having strong infrastructure for data collection and analysis. And so that means having the required agreements in place so that we have access to the data that we need, and then ensuring that the various data systems speak to each other. Dave Readers, who's going to talk to you after lunch, is going to talk about this a whole lot. But it's key in our area, it's key in all of the program areas, but I'll just emphasize it as I did last time for fraud, waste, and abuse detection and identifying our spend and making sure our spend is appropriate and accurate and we're accountable for it. In this area, it comes down to quality. We can't assess good quality unless we have the data to do so. Highly skilled workforce, I talked about that quite a bit, is really needed for development of our quality management and data analytics and reporting. And I mean, I think you know, it's this is just an area that requires a very skilled workforce to do the work. And then, lastly, I think is something a lot of program areas struggle with. There's just kind of increased expectations of what we can accomplish, but not necessarily additional resources. So we might not get the additional staff or additional funding for new IT systems, but everybody kind of wants more information all the time.
So as I get to know your department over time, one of the things that I'll be wanting to fill in the blanks around are the kind of the so what questions. If you're producing really great quality information, so what? What's the connection point between really great information you're producing to changes in DHHS or other organizational behavior, so that we're buying data that's useful and not just doing an academic study.
You are speaking my language. I totally appreciate the question, because that's what we're always really asking in this division. We're working with program areas to say to them, let's look at your data and ask the question, so what? You put all this money into these sets of providers or these sets of services. Where did it get us? How well was that program performed? How much better off is that population in particular? How are you going to know? And then how do you manage to that? How do you respond? So now you've got this set of data. What are you doing with it? There's a lot of data produced in this department for the purpose of federal reporting. So I'm making all this data and I literally just give it to the feds because they require it. But then what do I do? Have I managed to it? Have I said, so for example, with our quality assurance group, and this isn't my favorite example because it's federally required that we do quality assurance, but we, we do these audits of food stamp eligibility, and then we report on those to the feds. And that's meeting the requirement. But it doesn't do us any good unless we turn around and partner with our Bureau of Family Assistance and get to the root cause and say, hey, your error rate is this. Let's drill into individual topic areas and improve that error rate one by one. And we can teach you how to do it. We can do a plan, do, study, act. We can do all kinds of things to show, is this working to change? Is it moving the needle? That's the question we always ask. Are you moving the needle in the direction you want to see it go? But I fully appreciate it applies to our division as well. Are we moving the needle? So as we have these conversations with program areas, are we having an impact on them to actually manage better?
All
I think
right,
we're
thank you.
very much on the same page. Absolutely. Yep. So I don't,
There's a
yeah, do
question
you wanna-
with Representative Nordgren.
okay.
Representative Nordgren, you have a question here?
Yes, thank you very much. I would just second everything that Meredith said. On the previous page about the key challenges, the IT challenge for this department is a continuing saga. It's gone on for years, and it really behooves the state to bring everything up to date so we can get the answers everyone wants.
Yep.
Everything's outdated, we just hear this every time we have a budget discussion.
So could we go back to the previous slide with the areas of the one more, I think. Okay, so to me, the conversation we just had emphasizes the box on the left, but there's a fourth missing box of key challenges, I think, and that is that you're a relatively new organization that's not really ingrained into the management culture, so that you can help set up a data-driven management system that performs and can be measured. Am I just making that up, or am I hearing you right?
It's sort of a couple different, I'm gonna break it up a little bit. One is access to data is just really critical. And that's not always related to funding, but sometimes it is. And then the second piece is really that data integration and data management systems. Yes, I wouldn't say that's necessarily because we are a new division. We can use data management systems that exist already in the department and in the state, but it is sometimes a matter of having funding for more licenses. And maybe sometimes it's a matter of getting new data systems, but sometimes it's a matter of just being able to access what already exists.
Right. Well, I thought I had heard that maybe there's a key challenge in having the management of the other divisions of DHHS responsive to a data-driven management program.
Yes, I hear what you're saying. I would not say that's necessarily IT related. Sorry, I'm just trying to.
No, I'm just saying, is that a fourth key challenge? It doesn't matter. We don't need, let's move on.
Okay.
Did you have a question?
I'd like to say, I don't think it's a challenge yet. We are relatively new, and I'd like to think that they will be responsive as we engage with them. So far, we've been working pretty intensely with the Bureau of Drug and Alcohol Services in particular, and they are very responsive to our partnership. I'll put it that way.
Thank you. Representative Bean, it looked like you may have had a question. I don't want to pass you by. All right.
Is there another question?
No, we're ready for you to keep going. Sorry.
Okay, sorry. So at this point, do we want to take a look at the budget page itself?
Please.
And that would be budget book page 1182. Karen, I'll stop sharing.
So as I look at this, Ms. Rounds, the one that jumps out to me is you've got total salaries. If you add them all up, it's like 2.3 million, and all the fringe benefits is about 1.2 million. So that looks to be about a 54% that for your salaries, you've got another 54% for fringe benefits. And that doesn't seem to me like that percentage holds up across the other divisions. And I'm curious if I'm doing bad math or if there's something anomalous about the way fringes are calculated here.
I can get that information from you. Again, the fringe benefits, we're told how we have to calculate those, so I will get you that information.
Okay, but 50, I'm used to seeing in the 30s a lot, but 54% just seems outrageous. Like there could be an error there or something. I don't know.
Okay.
Does 54% sound about right? Is that?
I honestly don't know off the top of my head. There's so many other numbers I memorize. I don't memorize the DAS percentages.
All right. So in this division, and maybe it's true in others, I would just ask you to take a look at the two lines on benefits and relative to all the salaries, and because it just doesn't make sense looking at it to me.
We can provide you how DAS requires that to be calculated.
All right. Are there? I interrupted you before you could say anything about these line items. Did you want to tell us something? It looks all like it's very flat line budgeting. It's all no more people, a 1% change in the state budget. Is there something here that you want to highlight to us?
I don't think so.
Are there any questions, Representative Wallner?
Just my question that I had asked before, were there any prioritized needs that were not addressed here? And is this the request that you gave to the governor's budget director?
I do not believe there were any prioritized needs here. And I do believe it is the request that we gave to the governor.
Great. Could I ask one further question?
Yes, ma'am.
I might have missed it, but what is your vacancy rate in this unit?
In this unit, I believe it's pretty low. Susan, do we have one or two?
One, we currently have one position that's
One
vacant for the
vacancy,
28.
yep.
Okay, great, thank you. It's good news.
Are there any questions?
It is.
Other questions? Okay, so where are we at? Or do we have another presentation, or does that wrap it up?
Just department audits. I have 2 slides on department-wide audits.
All right.
Am I sharing?
Believe it or not, this may be my favorite 2 slides.
Okay, I completely understand. You should. I am also very interested in audits and auditing. Make sure I got back to my PowerPoint here. Yes, current slide. Down here. Oh, this and this, sorry. This was the slide that you had referenced and asked about. If we
Yeah.
had an additional 5% or a 5% reduction, what would we do with that? So you can see here, data systems enhancements. Once we have a chance to look through those RFIs, we would perhaps choose to engage in a contract with a vendor for fraud data analytics specifically. We would probably expand our use of Salesforce systems, because those are really helpful systems for managing cases and instances of fraud, or also quality metrics. We would expand what we can do for all areas of the department in terms of quality and performance measures. I mean, right now we're really focused on Medicaid and then DLTSS, and we do some work with behavioral health, and we do some work with the Bureau of Drug and Alcohol Services. But we're limited in what we can do, not because those areas aren't requesting more help, but because we don't have the staff and the time to get into all those areas. So I was approached by Chris Sentinel, this is quite some time ago, in Division of Economic and Housing Supports, to help with a QA process for her work. And we don't have the staff for that kind of thing. So we would expand into many other program areas of the department to meet their needs as far as quality and performance metrics, if we could. I think one of the key things that we're interested in, and I know department leadership is interested in, is enhanced contract management. So part of what we're doing now is what I talked about with subrecipient monitoring, but being able to build stronger systems of contract management. Right now, what we do for program quality, as I showed you in health services assessment, is pretty limited in scope. So we have a few providers that we do very intense reviews on, but we don't really have a mechanism to help all of the other program areas of the department engage in active contract management. And we would if we could, but that's not an area that we have resources to focus on right now. And then
What's kind of the so what there?
Contract management?
Well, the ones that are established and ongoing, are you concerned that there's some potential fraud, that there's what do you think would happen if you had better contract management for that uncovered set?
I think it is fraud on the one side, although we are beefing up our ability to do financial reviews of providers on a risk basis. So because we have that centralized function in our program integrity group. But on the program side, that's the side that I think there's room for improvement, in that our programs are doing oversight of their vendors, but not necessarily from a risk perspective, and not necessarily in terms of, when you think about active contract management, we can use our contracts to improve our population health if we've got the right metrics in there and we actually do active oversight of them. So we have to put a spotlight on it and say to the providers, hey, we've got 12 of you providers out here, right? And your median for this particular metric is 12%. We want to see the whole median get to 15%, for example. Well, now if I know the median is 12%, I can call out 2 or 3 providers who are way below that median and say, hey, you guys, you're the problem. You're the reason that as a state, we're only hitting 12% on this metric. That's the kind of active contract management I'm referring to. And our program areas are not really engaged in that kind of contract management at this point.
Can I also just add to that, this is where there's a strong relationship between the work that Meredith does and the work that my team does in contracts and finance. And I would just share from my previous experience as an auditor that 95% of the time when you find an issue, it's a mistake or a misunderstanding. That 5% is where you find some fraud or some purposeful disregard, but even sometimes purposeful disregard isn't necessarily fraud. I get a little nervous with the word fraud because it's not always that. A lot of times it's just a mistake or a misunderstanding.
Thank you.
Definitely, yep. And then another skill that we'd like to be able to develop, or something that we would do more of if we had the resources to do it, is in-house strategic planning expertise. So this is something that's done across the department, sometimes in-house, sometimes with an external vendor. We do have in our HR folks who are highly skilled at facilitating these kinds of conversations about helping you develop your mission statement, your key goals and objectives and key performance indicators. But it's not necessarily all rolled into a strategic planning exercise. And that's something I think we would like to develop, because we've used external vendors to varying degrees of success. I'm sure folks on this call have had the same experience just in their lives. Sometimes in-house strategic planning exercises can be successful, but you have to take a lot of time out of your normal day-to-day work in order to engage in that kind of thing. And if you're trying to actually run the process yourself, it's that much harder. So I think being able to centralize that function and have one area that's really got the expertise, where we can partner with individual program areas on their strategic plans and development of dashboards, it would be a long-term benefit to everyone.
Is that redundant or integrated with what the management office ought to be doing? We heard that brief last Thursday.
When you refer to the management office, I'm not sure who that would be.
Mr. Ripple, what's the official name of the? You're muted. There you go.
So from the commissioner's office presentations last week, not sure specifically which one you're referring to.
There was a bunch of budget line items that said management office in it.
Okay. I'll have to take a look at that.
So let's not pursue that and just say, as you're thinking about that, please don't be redundant. Look for integration.
Believe me, this division is constantly looking for efficiencies. We're very lean oriented. We would not want to duplicate something someone else is doing.
Okay.
And that includes, so for example, I was referring to HR, because they do have a function like this that works with other people, and we would make sure we're not overlapping with what's happening there.
All right. Did you finish it? Or did you have your decrements you want to talk about?
And the decrements, fewer reviews, really. I mean, it just comes down to less of what we're doing and doing it with less rigor. So we would have to decrease our sample sizes, would have to decrease the number of things selected for review, maybe a smaller distribution of things selected, or just smaller samples within each area of distribution. Definitely would lead to a likelihood of increased audit findings and repeat audit findings, and poor Medicaid cost containment generally.
So my question about that is that there's this Pareto principle about the 80-20 rule, where you get 80% of the bang for your buck out of 20% of the effort. So as you look at the reviews, and where do you think we are relative to the 80-20 rule? We're only doing 5%, or we're hitting the 20% that's going to give us an 80% return? What do you think?
So I think it's getting a little bit to what Karen is referring to, right? Like, we do a series of reviews and then we kind of say, not all of this is fraud. Some of it is just an issue that we need to deal with elsewhere. Is that kind of what you're?
I'm asking you for what your instinct is. Are we on the 80-20 cusp, or are we way under or over getting the 80-20 rule implemented in your department?
What we are doing is trying very hard to orient all of our work toward risk. So I don't really want to fall into an 80-20 where only 20% of our work is producing 80% of the benefit. We're trying to parse out the work so that we can say, based on the risk level of whatever it is that we're doing, we're going to orient all of our work that direction so that we're getting more bang for our buck. So for example, I mean, I think I referenced this in terms of the contract oversight. We have a formal risk analysis process where for both finance and program, we evaluate our contractors when they submit an RFP to us and say, you are high risk for finance, not for program, but you are for finance. So we're going to enhance our oversight of you on the financial side. Or conversely, we're not worried about you financially, but we see risk as related to the program area. So we're going to shift our resources and pay attention to you in the program area. So I mean, because we have limited resources, we don't want everybody to just do everything uniformly and say, well, within 20% of this, we're going to get 80% of the work out of it. We want to say, out of everything that we're doing, we're going to make sure that maybe 20% of it is focused on low to moderate risk, but 80% of it is focused on high risk, because that's where we need to be concerned.
All right, thank you.
I don't know if that answers your question, but it's sort of the philosophy of the way we approach all of our work.
It's the start of a 2-year conversation, I think.
Yes, indeed.
So are we ready for the audit? Yeah, there we go.
Audits, yes. So we've got a few different types of audits. I saw that one of the requests was the last 10 years of audits. I have that. I can get it to you, but it's hundreds of audits and literally thousands of findings. So I wanted to start with just a description of what we have in terms of audits, what our audit life looks like at the department, and then we can go into whatever additional detail makes sense.
Let's skip this, because I see you got a list and we can follow up. This is great. Just do you have a slide that gives us an idea of what you're doing for a corrective actions program?
For findings. So for recurring audits, single audit finding, okay. These are kind of examples. This isn't comprehensive, obviously, but I'm trying to give you a sense of what we do and what we're looking at in terms of findings. So the single audit we get every year, they're looking at 5 to 10 major programs across the department. And then in addition, they'll do a handful of type B, like lesser programs. And out of that, we've been reducing the number of findings we get. It used to be over 20, sometimes close to 30, and now it's down maybe closer to a dozen. I mean, it depends on the year. But so one of the recent findings we had was non-compliance with maintenance of effort requirements in our what's FEP, Public Health Emergency Program, I think, and hospital emergency preparedness program. Yes, go ahead. Sorry.
So you're doing very well at answering the what. I'm actually questioning about the how. How do you manage your corrective action program? How are you taking these audits, putting them into some kind of a findings tracker? How are you managing the delegation of responsibility? I'm more because the what is going to change over time, but I'm really curious about the how.
So we have 3 different areas of the department that are responsive to audits. One is our internal auditor is managing all of the Lba audits. One is our financial compliance unit, and they're managing all of the federal audits. And then within our Bureau of Information Systems, our privacy officer is managing IT related audits. So they're kind of divvied up. When we get a new audit notice, those 3 have a conversation and say, all right, who's lead on this particular item? And then they act as a liaison, like what I was describing before. They would act as a liaison between the program area, finance managers in that area, or the IT, the systems owners in that area, and the auditor, and say, all right, what does the auditor need for documentation? What's happening? What are they looking at? What does it look like they're gonna find in this instance? And manage the audit itself. And then the findings come in. And then that same person, whoever it was that was the lead, is also responsible for managing the corrective action plan on those findings.
And,
we don't.
So I assume somewhere you have a holistic top-down view of all the outstanding corrective actions, and that
we do not. We do not. So we are looking. Yep, we are looking to, it's kind of in development as we speak, but that is a key area that we are trying to work on.
So just to tie you in, I have asked Mr. Kane and Mr. Smith from LBA to reach out to you to talk about correction action plan formatting and reporting, because it sounded to me earlier that you may have something that you use. So if they reach out to you, don't be surprised.
Yep, absolutely. And we can certainly have that conversation. It's having a holistic single system is certainly a goal of ours, because we want to be able to have at our fingertips, where is this finding, what is the status of it in every instance, but it doesn't exist yet. So far, we're having to manage the individual audit areas manually.
I really appreciate your honesty and directness, because you know, a lot of people don't like to share things that aren't perfect, and I appreciate your honesty.
Well, I think we're very much on the same page. You know, I mean, I want to see that improvement, and we have. I think what's really important is that a lot of what this division does, dare I say, like 100% of what this division does, is we put a spotlight on the areas that are more like kind of administrative functions that the program areas can't really spend all of their time on. And when you put a spotlight on something, it changes necessarily. Even though when people they're not even planning on it changing, just because you keep poking them on it and saying, hey, this metric is still 12%. Hey, this metric is still 12%. They can't even help it. They start focusing on it. And the next thing you know, it starts to change. And we do that in a lot of different areas, including on the audit report. So like I said, even without that system in place, we brought down outstanding findings from 63 to 9 just by putting a spotlight on it. And also, I mean, I think part of it is the auditees they just don't always speak the language. They don't always understand what the auditor's looking for as a remedy. So us being able to say, no, they're not looking for the thing you're doing. They want to see like a formalized risk management plan or something like that. Being able to speak the language, we've certainly managed to make improvements, but we don't have the system you're referring to. So if I need to know where findings are, I have to go to the individual audit manager and say, tell me where this is at and what are we doing with it.
Thank you very much. Is there one more slide?
I think this is, oh, there is. This is specifically related to information security type audits and findings.
I don't like that PCI.
I will warn you right now, this is not my area of expertise, but we do liaise with BIS for their audit management, and they work with us on our audit management because it's all intermingled.
All right. Okay. Are there any questions? Anyone? Representative Wallner, what should we be asking here?
Okay. I'm sorry, I'd have to look at this slide for quite a while longer.
So do you think this is something we can look back on in 3 months after the hard work of the budget is done to just dig into some of this?
Is that a question?
Yes,
for me?
That's for Representative Wallner.
Okay.
One question I would have, and I lost the slide again. Lost the slide. Meredith, I guess one thing that it would be interesting for me to know about these audits and these findings is, are any of them causing us to lose federal money?
On this area, I can't answer that right now. Dave Wieters might be able to, one moment. Let's see if I can answer that question in real time.
Why don't we take that offline? Write that down and get back to us on that. Are any of these audits
could. So the answer is they could cause us to lose, but they are not yet. They're not at this time. Yep.
Okay, thank you.
Representative Nordgren?
Well, yes, thank you. Well, on the other side, the fact that maybe we're finding out we should have gotten more money. So both sides of the coin, hopefully we'll discover that side of the coin too.
Yeah. Representative Weiler, I just want to, since I've listened to you talk about audits in fiscal committee, I just wanted to give you a chance to say something since we've gone through it here.
No, I'm delighted that something is happening central. I haven't seen the effects of this division before on helping these others with answering the audits. And I guess one of the first ones is going to be the New Hampshire home or New Hampshire hospital, which had a fairly serious audit last time. So I'll be looking forward to see what happens. And when I do see answers, this unit doesn't really get credit. I do read a lot of audits, and now we've decided this last meeting, we want monthly follow-ups to see what the progress is, because otherwise we see a budget that, or we see an audit that is a follow-up on one from 10 years before, and the majority of the findings are still outstanding. So yes, there is a definite need to do quicker follow-up and do more things happening. So I'm looking forward to seeing what this division can accomplish. Thank you.
And just so you know, Representative, we have set a task for ourselves to be responsive to all the audit findings within 24 months. So that's what we're looking at right now.
Very good. So are there budget line items to go with this this segment of the briefing, or we've already hit them, I imagine?
No, we've hit them.
Okay. All right. So I'm getting ready to call a recess for lunch. But before we go, does anyone have I missed you? Does everyone have their questions answered? Yes, sir, Mr. Representative Weiler.
Do we have another slide deck to download for after lunch?
I think you already have that. I think you received that via email the other day, and it's also on our website.
So what am I looking for? I don't remember receiving it, but give it.
Yeah, you see an information services, sir? I think it's called OCOM B information. The cover slide has
If I
David.
can find it when I'm at lunch.
Bureau of Information Services. I can email it to you again too, if that's easier.
Yeah, appreciate that. Thank you.
Sure.
All right. So it's now 12:22. Why don't we recess until 1 o'clock? Does anyone feel like that's too rushed? All right. So with that, we're recessed until 1 o'clock. Enjoy your lunch.
Thank you.
So let me just ask you to summarize this box where MMIS is the second bullet. Of the following systems, are those all legacies, or are those relatively new implementations? And if they're legacies, where do they stand on your replacement schedule? That's kind of what I want to know about those items.
Certainly. So as I earlier stated, Mr. Chair, the MMIS is our first one on the 5-year strategy to re-procure individual components. The New Heights, New Hampshire Easy Integrated Eligibility System is a system that's been around a while, but has been properly maintained, and there was no deferred maintenance on that system. So I would say it's actually won many awards in our country for being a very effective integrated eligibility system. Our plans to re-procure that begin in 2024, not in the next biennium. The options or elderly adult care system is one of our systems that is also at risk, that we would be looking to re-procure a solution for. It is a homegrown .NET application, that we would like to look at a commercial off-the-shelf solution for, that could not only combine with elderly adult care, but developmental services and other areas within long-term supports and services. So we can have a single cohesive case management solution to provide those services. Our Nexus or child support system has undergone a major overhaul this biennium, where we did upgrade the system and did some major releases. So we were looking to replace that on a reprocurement roadmap of 2026. Beginning that year, it would be a 2 to 3 year reprocurement program. If at the time the state determined that it was beneficial to replace the system or look at potential major enhancements at that time. The Web Information Technology System, also known as WITS, which is our Drug and Alcohol Services System, is a legacy system that we outsource to a vendor that we don't have in our current biennium operational or capital submissions to replace, as it is meeting the expectations. It's not exceeding the expectations, but we needed to identify when we would replace it. Our goal was to start replacing that system in 2024, 2025. And then our SACWIS, or Child Welfare Information System, is a legacy system. It's been around for 27 years. We currently have a capital program for this biennium, as well as planned for the next 2 bienniums to replace that system. It has an intake, assessment, case management, and claims component. We are goaled at looking at that claims module and seeing if we have a departmental claims opportunity, as opposed to having multiple different claims systems within the department, looking at a centralized claims solution starting in 2026 to implement, so that we can utilize that for our long-term support services claims, for our fee-for-service claims in that division, as well as our child welfare information services claims and Medicaid claims. Did that summarize for you, Mr. Chair?
Thank you. That was excellent. And I know that we're an operations budget group here. In the future, it may be nice just to have one of the roadmap slides, so we see, some long-term capital planning, just to, because I think it affects your operational costs too.
It certainly does. That was actually a question I was asking our chief financial officer during the break, is how do we coordinate the communication between capital and operating? Because operations is very important, but capital impacts the strategic planning and directions, as well as impacts for future operational costs.
So Representative Weiler, do you want to field that, or should we take that offline?
Yeah, probably offline. I don't want to work on it yet.
All right, thank you. So that's a great question, and I think collectively the legislature owes you an answer. I don't know how we'll get it to you, but we'll keep track of it. That's a great question.
I appreciate that, Mr. Chair. It appears that you have another question by Representative Erf.
Oh, there you go, Representative Erf. Go ahead.
Could you just clarify, now that you've told us that 8 of the people we thought were in your department are actually over in another department, could you clarify where the either 22 or 18 positions, the 22 you currently have or the 18 you will have, are in your department?
Sure. So thank you for the question, Representative Erf and Mr. Chair. We have 9 positions that are supporting the project management office in Lean. And then we have 9 positions that are currently supporting hardware application lifecycle management, information security, and data warehousing support, as well as strategic planning and design. So those 9 people are broken up into several different program areas. We have 2 for information security, 1 for application lifecycle and hardware lifecycle management. We have 2 for data warehousing and reporting that work hand in hand with the other data teams. So that's up to 5. And then we have the deputy director and myself, 7. And then I'm getting ahead of myself here. And then 2 for information security, 9.
So those positions are all filled with people.
They are not. Those are our total amounts. So of those, we are 33% vacant in both teams. So we are down 3 people in each area. And so we're essentially operating with multiple hats across all of the departments.
Thank you.
So just the remainder of this slide here, this application lifecycle management program is goal to implement, and it did implement this year, the Grant Trace, which is our contact tracing, patient monitoring, and case investigation. It leveraged a Salesforce platform, which our goal is to leverage that platform and the licensing associated with it across our department as much as possible, where applicable. We also implemented, and so that Grant Trace is really focused on COVID-19 response and how we could understand what was happening when people were identified with COVID, and then be able to monitor them and then do case investigation to understand community transmission. The New Hampshire Connections solution is our child care registry and licensing program, which historically has been done in Excel spreadsheets and Access databases, which were prone to error and failure. And so our goal is to implement a system that could manage all of our childcare professionals and their registries and training and certifications in a single platform. Again, that was implemented on the Salesforce platform as part of the COVID-19 pandemic response to ensure timely certification, registry, and licensing for those childcare organizations. And then, as I spoke about earlier, Granite Families, which is our comprehensive child welfare information system, is the replacement for this item above in application lifecycle management of SACWIS. And it will be a 6-year plan to replace. We're expecting to go live in year 5 with that system, but incrementally throughout, we're already beginning to go live with parts of it. And so why would we do that? The benefit is we're able to implement key components that are having what we would call trouble areas. And we're implementing an agile methodology, which is allowing us to take ownership of components of the system and utilize it earlier than if we just waited until the end of 5 years to start. This does 2 things for us. It enhances our services sooner, which basically improves our productivity, but it also gives us more visibility to what changes we need to do to meet the end result in 5 years. And then the last one here is Ombudsman Case Management. And there's other ones as well. I believe Meredith Tellus referred to it briefly. We implemented a Medicaid quality assurance case management solution on Salesforce as well. And we were able to do that rather rapidly based off of the federal funding for integrated eligibility components. And we were able to leverage it with ACF funding as well for Granite Families. So these federal partners have really helped us with 90-10 match, or 90% federal funds, 10% general fund match, to acquire the licensing and implement the systems. So the last component here is hardware lifecycle management. And this is maybe the rest of it's boring too, but this is the super boring part. But basically it comes down to we're replacing servers, storage, switches, computers, pretty much any technology device that allows our clients, our users. And so when I refer to clients, my customers are the employees of the department directly, and then my further clients are the citizens of New Hampshire. But this is where we're replacing all of that hardware and software. We distributed a little over 1,000 computers this last year, and we have about a little over 3,400 devices, or like laptops or desktops, throughout the organization that we try to replace on a 5-year cycle. This last year, we implemented many more than we normally would. As a result of the COVID-19 pandemic response, we had to implement computers for temporary needs with the National Guard being activated, as well as large call center implementations.
So we have a question with Representative Irf.
When you mentioned these Granite things here, Granite Trace and Granite Families, are those part of Granite Pathways?
That's a good question, Representative Irf and Mr. Chair. They're not part of Granite Pathways. What we try to do is, working with DOIT, I believe everything, like the big enterprise type systems have a reserved name with Granite in the name.
Okay.
And so the idea was when we, it's like Granite families or the legacy system used to be called Bridges. So what we were trying to do is use the Granite families as a branding to say this is a New Hampshire family system. And then when it came to Granite Trace, a New Hampshire contact tracing solution.
Okay. So not part of the expanded Medicaid.
That is not part of expanded Medicaid.
Thank you.
So my question about the hardware lifecycle management, how many FTEs do you think are invested in that, state employees? And then I assume that there's a fairly significant contract support there. And could you tell us about that?
So depending on the hardware itself, Mr. Chair, it would be, so when it comes to distribution of computers, we have several different teams from Information Technology Department or DOIT that are distributed across the state locations. So we have some at our Hazen Drive, some in our Brown building, and some in other buildings across our campus. And so I would identify as about 9 people from DOIT that helped us distribute those devices. And it included about another 6 of our individuals within the department to get that done. When it comes to the cloud hosting solutions to reduce costs on the state resources, we leveraged a contract with Deloitte, and it was fully funded by Center for Disease Control and Prevention funds to essentially to implement a cloud hosting solution for our public-facing business intelligence reports. And then when it comes to database hardware and the associated like server, storage, and networking equipment, it was a mix between DOIT professionals as well as we also leveraged the funding from Center for Disease Control and Prevention to upgrade our hardware on premise or on site in our data center managed by Department of Information Technology to enhance the performance as well as include the storage necessary to bring in all the different data sources related to not only the COVID-19 pandemic, but the opioid crisis, as was referred to earlier in Meredith Toulous's presentation on the opioid crisis dashboard. Did that answer?
Okay, so, well, it does, but it was kind of, what I'm really trying to get at here is this feels like an area that isn't necessarily a value-added service. It's not part of DHHS core competency, and I'm just wondering if there's any strategic thinking going on in this area to rely more on contract support, so that the few professionals that we do have with a 33% gap there, that we maybe can reallocate them to the value add business analyst kind of positions. And we can take that offline because that's a whole different discussion. I just would like to know if DOIT and DHHS are thinking about redoing hardware lifecycle management differently in the future.
Mr. Chair, we certainly have had those discussions. In this whole slide really is operated by one person. We have a senior IT asset manager that is responsible for the application and the hardware lifecycle management, along with myself and the deputy director. So there really wouldn't be too much reassigning available, and that person works hand in hand with the DOIT professionals helping to deploy the hardware and the vendors deploying the applications. But when it comes to strategies in terms of like leasing equipment, getting a contractor to do deployments, and eliminating the resources on the ground that are supporting our agency on a day-to-day basis, we certainly are having those discussions with DOIT on a regular, I would say monthly basis, to decide how we move that forward. I would be looking to Commissioner Goulet to see what his strategic direction would be on that.
Outstanding, thank you.
Pardon me. So Sorry for all the text, but some of our key accomplishments we already sort of addressed. But in the enterprise business intelligence platform, we were able to implement public-facing COVID-19 pandemic response dashboards. We have an opioid crisis response dashboard that is ready for the public, but has not been published yet, but we are planning to publish it soon. And then internally, we're continuing to evolve the master client index, which right now, as of today, integrates several of our different systems, as I referred to earlier, the child support system, child welfare information system, elderly adult care, Medicaid, and integrated eligibility. But our goal is to expand that and to include our behavioral health system, which is now landed or is present in our data warehousing environment, but is not integrated at a client level, as well as other public health and New Hampshire hospital systems as we go forward. We also were able to create that scalable infrastructure for the dashboards that are being currently used across all divisions within the department. And that system, as a result of funding from grants, was able to be expanded for the next year to 2 years. And our goal is through a capital request to continue to fund that. Security and awareness, in conjunction with the Chief Information Security Officer, DOIT, successfully implemented a department-wide training and awareness program this past January. And we're also streamlining contract processes for security and privacy by creating templates that have been vetted by multiple vendors, as well as throughout our department, DOIT, and the Attorney General's office, to be compliant with our federal and state policies and legislation. And then we also, in terms of data management, we implemented data classification policy so that we could track what data is allowed to be shared at different levels and what kind of governance needs to be addressed for each one. This was critical for privacy management for the state to ensure that we can see who has access to what and when and why. So that whenever anyone asks us, why are we sharing this data? This is how we're sharing it, and this is the laws that allow us to share it and whatnot, for example. We managed and met auditing requirements associated with several different auditing agencies listed there. And then from an interoperability and integration perspective, we deployed those departmental case management systems so that we could rapidly respond to the needs. Had we not started that initiative this biennium, at the beginning of this biennium currently, we would not have been able to meet the needs of contact tracing, child care licensing and registry, quality assurance components, as well as Ombudsman's Office case management processing. That was a key success for our department to be able to move those systems forward in months as opposed to years, and in sometimes weeks, in some cases weeks. The grant trace solution was implemented over a weekend. It took us 4 business days to get, and when I say 4 business days, Friday, Saturday, Sunday, and Monday, to implement that solution. And then at the end of the calendar year of 2020, we did implement the closed loop referral system, which is goaled at improving our care coordination between our providers of our state. And then the final component here is system stabilization. So we're working on a strategic plans across the board. We started with the Medicaid Enterprise Strategic Plan, which is a 5-year plan addressing all of the components of the Medicaid Enterprise, as well as Organizational Information Services Strategic Plan, which is representative in the Agency Information Technology Plan that the Commissioner of DOIT publishes. And then we have a portfolio of our projects, which is we average about 120 active projects at any given time. And as a result of having a small staff, we usually complete anywhere from 20 to 30 of them per year.
I want to step in here and brag on you guys for a little bit. We went for most of the year 2000s with one strategic plan that never got updated. And now it seems to me like you are with DOIT in a regular rhythm of doing strategic planning and updating it. And that is a huge step forward, I think, in the professionalism of the effort and the benefit that the state will get out of that. So I just wanted to highlight that from what I've seen, you guys are really doing a great job in the strategic planning area.
Thank you very much, Mr. Chair.
Now, I want to come back to something though, because I said something good. Now I have to go the other way, keep it balanced. So I see that you've got security and awareness, and you got the payment card industry listed there. And I think we have an audit outstanding where we have some serious problems with our PCI standards. Are you aware of that audit? And are we at the point where we need to remove permissions for using credit card payments?
Mr. Chair, I am aware of an audit regarding the payment card industry of our state systems. We are peripherally involved as a supporting agency with Department of Administrative Services, which is the lead agency, I believe, on that audit. I don't believe we need to remove access because we did implement a new contract as a result of some of those audit issues. And I believe we're going to be able to address any concerns regarding the sharing of credit card information. But I would leave the official answer to Commissioner Arlinghouse to address it as needed. And I believe that's where the lead agency is on that. But I can follow up on you on that for you if you would like.
I would, and I don't have direct contact with Commissioner Arlinghouse. But
okay,
having PCI problems is concerns me. Just go ahead.
So it's a concern for us as well, Mr. Chair. So key challenges for the organization, again, the main challenges here are lack of interoperability between our systems and integration. We've made headway on those challenges, but we need to continue our efforts. And the reason why is that not having integration and interoperability between systems lends itself to duplication of effort, wasted time on solutions that have already been thought through and strategically addressed, and really takes resources away from their true intention of the role, which is client services. And so the goal here is to continue to evolve our systems of record of our technology systems to make them interoperable where we can, to work with the legislature to identify ways in which the legislation may or may not be impacting the ability to do that, and then having that overarching strategic plan of how we're going to get there. Additionally, there's a lack of funding, and you'll hear this throughout all of our different bureaus, is we've deferred maintenance on many of our systems. And in some cases, due to the deferred maintenance, it did not mean that we weren't able to, we didn't have to provide the services. It meant that we had to go through manual workarounds, either creating spreadsheets, access databases, or other smaller systems that are prone to error and can cause actual more work in the long run and reduce services as a result. The continuous loop of lack of technology to support our employees has resulted in these manual workarounds. And what my goal is to work with the different teams across the department, as well as hand in hand with Department of Information Technology, to identify those systems and provide an operational as well as capital approach to replacing those systems over time in a strategic way so that we can enhance our services. And then the final component is information services team, not only in my bureau, but also the ones embedded in different areas of the organization is severely under-resourced. So on a rolling average, we support 120 projects. We're only able to really get 30 projects done each year. So that leaves 90 projects that don't get touched year over year, which results in continuous workarounds and failures to meet our citizen services. Our goal would be to look at the different areas within the department and identify ways in which to expand those information services teams. And when I say information services, it's business analysts that really drive what are the needs of the organization, how do we translate those into technology solutions if there is one, and really support business process management. Mr. Chair, I believe you have a question.
I do. I'd like to know if you're aware of any industry benchmarks that would be relevant to suggesting what your appropriate staffing level might be.
So, and I can't remember the exact website, but I've been listening to some of your questions of my peers, and there are different benchmarks that we probably should research more that would say for project management, it would be anywhere from 1 to 10 or 1 to 20 projects for PM, depending on the size of the project. So if you have a very large project like the MMIS or Medicaid system, you probably want to dedicate resources to that so that they're not getting distracted on other systems.
Sure. So let's just abbreviate it and say that let's talk in the future about external benchmarks as you learn more about it and get some good examples.
And the other benchmarks that we were looking at is how many technologists per employee. And so a lot of those are usually at the organization level. So if we have 10,000 or 3,300.
Right. So I'd be concerned about even counting those, right? Because how do they, unless they have an additional job identifier that is an additional duty that they do, they would just be buried into the weeds of each department. So, but all right, I feel your pain. I've been here. So, all right, we can keep going unless there are any questions. Oh, there's one. Representative Wallner.
Thank you. So you mentioned before, I'm surprised it doesn't show up on your key challenges, that you have been down you're down 33% of your staff. You're down a third. That seems to me like a pretty big challenge. And what I'm wondering is, how long have you been down that many staff? And what do you think attributes to that? Is that you can't hire people in this area, or that the wages are out of sync with the private sector? What attributes to such a high rate of vacancy?
Certainly. Thank you for the question, Representative Wallner and Mr. Chair. So you're right. This third bucket here of information services, the resources, is a huge constraint. And our 33% vacancy rate has resulted from retirements. So we've had 2 retirements in the project management office. And then we had a retirement as well in the information services. And then we also had 2 people leave the state to go to private sector, and those people moved on because they were able to double their salaries as a result. So it was a very easy decision for them to make, where they're saying, we can do the same job or less work and make more money. So it is a challenge. We don't, government as a rule is not always competitive with the private sector. However, I would say being within 15 to 25% of the private sector would be a good goal to attain. Right now, we're probably closer to 40 to 50% less than the private sector, which makes it the pool of people that we're looking for are either people that are just getting into the field and need to be trained, or they made their career in the private sector and now are retiring to come to our organization to support as a public servant. So those are our main pools of resources that apply for positions. And in a lot of cases, it's really beneficial to get those people that have 30, 40 years of experience. However, it results in an attrition rate at a much higher rate because they come for a few years and then they leave because they've already retired from one career, and then they're coming here to try to offer their services, but they're not here for a long term. So our goal when working with human resources is to address this attrition and this recruitment opportunity. And we can't necessarily always impact the salaries at which we offer, but we are trying to be more effective at our social media presence as well as our recruitment expertise in terms of taking what we normally would just post out there, which is a supplemental job description, and making it a little bit more enticing of why do you want to move to New Hampshire, or why do you want to work for Department of Health and Human Services.
Do you have a follow-up, Representative Wallner?
I do. How long have you been, had that many vacancies where your third of your workforce is not there?
So the majority of the workforce was full prior to the pandemic. And then as a result of the pandemic and the hiring freeze, we had people retire and move on to other organizations that resulted in vacancies in this specific area.
Okay, I have, if I could have one more question.
Yes, ma'am.
Okay, could you talk just for a minute? I did notice on your budget pages that you do have a very small amount of funding for overtime. And I'm wondering if you anticipate that you're going to need to take a look at that line, because I'm just wondering how realistic is it that you're going to be able to build up your workforce that quickly in the next several months or even year. I mean, I would think it would take a long time in this area to build up your workforce.
Thank you for the question, Representative Wallner and Mr. Chair. The overtime budget is primarily for a few key individuals. I would say the majority of the positions in the project management office are unclassified salary positions, as well as myself and three other positions in the information services area. So 5 positions in information services and 1 or 2 positions in PMO would be subject to that overtime. And currently we're leveraging COVID-19 response funding for the overtime, because that's generally where the overtime is being hit. And where we're pushing overtime is into the program areas or the division areas where they have information services teams and they have larger overtime budgets to accommodate that. So that was our general approach, but that key indicator that is that we may have a difficulty remaining in that overtime budget in the next 12 months.
Thank you. It seems like a big challenge.
Let's do a time check here, Mr. Ripple. After we complete this slide deck and do the accounting, are we done for the day?
You are, yes.
All right. Very good, thank you.
I'll try to go faster, Mr. Chair.
No, I'm slowing you down, I'm sure. I just, I need to provide testimony at 2:15. So if I have to go, then Representative Earth can finish it out.
Okay. So one of the questions was, what would we do with a 5% increase or 5% decrease? The increase would be reflected in about a $2.2 million increase across the whole budget. And the goal there would be to improve our care coordination in our integrated eligibility environment. And so our integrated eligibility continues to evolve. We submitted a capital project that was removed from the governor's office recommendation that we still would need to be able to meet for expansions of that integrated eligibility function. And there's several different components, self-service functionality to include ADA accommodations, as well as newer technology like chatbots, where they can address questions quicker, and numerous different enhancements to meet our service needs in the integrated eligibility. Additionally, we would be looking to improve our interoperability of systems and expansion of our state's systems like the closed loop referral, so that we could expand into hospitals and then eventually into the managed care organizations, so that we would have a closed loop referral system, which allows for a citizen to go to any door and be able to consent to release their information if they so choose, to be shared with, say they were showing up at an emergency department for some sort of health related issue and they needed food services, then they would be able to have that information released. They would be consenting to that release of information and immediately be contacted by a food services organization. And that would continue through. If the food services saw other needs and services, they would be able to be part of that common network. If we saw a decrease, that would have a severe impact on our operational capabilities to maintain our systems, because we are pretty lean. And the majority of our budget resides in the Class 27 transfers to the Office of Information Technology. And that $2.2 million decrease would impact our ability to support the eligibility system. It would also defer maintenance. We would not be able to provide any replacement for computers in the next biennium, as well
So is
as
that line 27 transfers to OIT? Is that what you're referring to? That would take the biggest hit?
yes, Mr. Chair. We would have a choice, I guess, essentially between hitting that line or laying off staff.
Yeah, and so that OIT, that's the DOIT?
That is correct, Mr. Chair.
All right.
So this Class 27 is in the information services budget is where all of the transfers to Department of Information Technology occurs for the department. And it's where we pay for those common services like email, file services, and web services, but it also is where we pay for our direct costs, including like eligibility systems, child support systems, and general maintenance on everything that we do for an application.
So am I right to believe that that line has your Deloitte money in it and that DOIT is actually paying Deloitte?
From a contractual perspective, Mr. Chair, I'm not exactly how it gets paid, but yes, there are components of the Class 27 budget that does have the Deloitte contract in it. However, we contract with Deloitte for more than just the integrated eligibility system. As you heard earlier today, we also contract with them for our data warehousing and data analytics, which is primarily—
I'm not seeing a line item that's big enough for any contract. So I'm assuming that that's all your contract transfers right there.
That is correct, Mr. Chair. But there are some contract transfers that are within the program area specifically associated with grants.
Okay. So earlier today, you may have heard, I suggested to Ms. Tellis to follow up with you to talk about eligibility, the integrated eligibility. I had forgotten you were 3 years downstream already, but you know, it sounds to me like she could make DHHS some money if she were able to streamline her eligibility efforts.
Certainly, and her team and I are in constant conversation. And so the challenge is we look at the third-party liability and fraud, waste, abuse as part of the Medicaid enterprise program, because it would be funded 90% by federal funds to support. And we didn't tie it directly to the integrated eligibility itself. We currently have it in the MMIS contract, and we'd be looking to reprocure that solution in the next biennium and work in conjunction with the Enterprise Business Intelligence Platform.
Thank you. Representative Wallner, you have a question? Your hand's up.
I do. I do. So if I go to your source of revenue, again, I see the situation where the general fund is going up and the federal funds are going down. Is that just a formula that's being used that's causing that to happen, or is that really that there is a difference in what the feds are going to support?
Dave, I can jump in there if you want.
That would be great.
So while you're jumping in, I'm going to ask Representative Erf to take over chairman duties. And if you guys are gone when I come back, have a wonderful day. Thank you for everything. And so I'm going to step away for a bit.
Thank you.
Are you ready, Representative Erf?
I am ready, Chairman, Mr. Chairman.
Okay, so what you'll notice in that change from 1819 to 2021 is also the total amount of cost has decreased some, and that is mostly due to us moving MMIS from the DOIT budget into the Medicaid budget. So those MMIS is generally 90-10, sometimes a little bit less. So the federal funds on that are the reason that the federal funds are decreasing there. They're over in the Medicaid budget now.
Okay, thank you.
So I skipped over this slide because we pretty much already covered it from a staffing perspective earlier in the conversation. And then we just jumped into this slide showing our funding changes over the year over year or biennium over biennium. Were there any other questions on the pie charts? Okay. So then from a information services accounting unit perspective, I would turn it over to Mrs. Rounds to support me, and I will certainly get involved when it comes to the details.
All right, if you want to stop screen sharing, I'll go ahead and share. So we are on the last accounting unit for the Office of the Commissioner, which is this one here in purple, 5952, Information Services, found on page 1181. That starts on 1181 and continues on to 1182, the largest being the class 27, as we've talked about, being the transfer to DOIT. Happy to answer any questions.
I'll ask you a generic question if nobody else has one right now. I noticed that there was a pretty substantial increase in that in the current year, basically. And yet there's still another pretty good increase, not as good, obviously, in this current year. Is that typical growth? I mean, the 15% I'm hoping is out of range, but is the 4% typical growth?
You're talking about the transfers to DOIT?
Yeah, I realize it's probably more of a Division I question. I thought maybe you would have some insight since you obviously fund a lot of it.
Sure. So I think, and I'll let Dave jump in here too. The largest thing here is the impact to COVID. And I think there were a lot of things that didn't move forward or ended up being funded with COVID funds because of the nature that they ended up being. That's really making that difference between 20 and 21. Dave, do you have anything you want to add there?
That's certainly the component. And for details, the Department of Information Technology implemented a couple very large platforms and along with us, which was the Salesforce components, as well as the Microsoft M365, which is migrating us to the cloud for email and file services, as well as our ability to communicate with each other through a teleworking environment. Those are the primary, so the shared costs that Department of Information Technology allocates to us increased primarily in that space. Our direct costs, which is where our maintenance and operations of our existing application systems and our computer hardware actually went down. And so as a relationship to those shared services increases. So that 5% increase is mainly, as Ms. Rounds indicated, related to COVID response, but also for a long-term perspective, we need to maintain those systems. So we needed to put the operating costs in place to continue those services.
I guess what I'm really asking is, do you foresee that growth has to continue to maintain your services, or that's a one-time step up?
So Representative Erf, that is not, it's an annual cost to maintain those services across those different systems until such time that we would turn them, we would retire those systems. So when we move to the platforms, cloud platforms, they're software as a service platform. So they basically are our annual costs.
No, I understand the annual cost. What I'm looking at is there's a big jump. We just talked about 15% in growth, not in, so in other words, increased dollars. And it looks like in the first year of this proposed budget, you've got another little over 4% growth. And then it drops about half of that. I'm just asking if you're anticipating that growth rate to continue.
That's a good question, Representative Erf. Sorry, I didn't understand the initial question. So the growth rate essentially would only continue based off of mandates that we would receive. So on a biennium basis, they do receive different mandates to implement services in the middle of the biennium. In cases like Center for Disease Control and Prevention may provide us a grant to implement a service or a solution that we're going to be required to maintain. But they'll only give us the one-time cost to start it up, but not the annual cost to operate. So I would anticipate that growth being anywhere from 3 to 5% on a regular basis.
Okay. Representative Waldner. Can you hear me? MJ? Oh, am I muted? No. Can you hear me?
I can hear you. I think she might be frozen.
Yeah. Can you hear me now?
Yes. Yeah, go ahead.
Can you hear me?
Yes. Yes.
No?
Yes. We
Okay,
can hear
sorry
you.
about that. Okay. So in 2020, this isn't just about this. Can you hear me now?
Yes. Can you hear us?
I can't hear Earth.
We hear you.
Mr. Earth, okay. I can hear you. Okay.
We can hear you.
Okay. So in 2020, you had about $35 million.
Now you're kind of breaking up. Maybe it's your connection.
Mary Jane, you're freezing up.
We lost you.
Line on the OIT line.
Yeah.
In 2021, it went up
James, start over. We lost
to 40 million. And that is because of COVID, was what I just said. Okay, let me take my, now can you hear me any?
I texted her.
Okay, I think she's going to log back in. Anybody else have any questions while we're waiting? No? If I can make some up.
Beth, could you just
Okay, I'm
share
back in. Is it any better?
Go, yes.
Oops.
No, okay. Okay. No.
Are you there?
Maybe she can relate a question through you, Sharon.
Mary Jane, your question.
Can you hear me?
Yes.
Yeah.
Okay. So let's try again. So you're up about $5 million from 20 to 21, and it's COVID related. Was that additional 5 million? That come from?
So what have we got? We're doing so well.
Maybe it's a signal we should quit for the day.
Never mind.
Never mind.
Okay. Yeah. Okay, sorry.
Who's on first?
So any other questions? Anything else you want to address, Karen?
I don't think so. Certainly, if Representative Wallner wants to email her question through the LBA, have them add it to their question list, we'll make sure to get a response back. Otherwise, I don't think I have anything to add. If there are no other questions, I would just say thank you to all my OCOM directors and to Beth Kelly, the finance director for OCOM, and she is officially off the hook.
And what are we doing tomorrow, Karen?
We are working on the Division of Economic and Housing Stability. The director for that area is Chris Santinello, and the finance director for that area is Rebecca Lorden.
And I believe Mike sent us those handouts today.
I think Kevin did, yes.
I mean, Kevin, I'm sorry.
You should have those, and they're also on our website.
Too many names. Right. Sorry.
And I
Kevin.
know that some people
okay.
like to have the PowerPoint versions. I will convert those this afternoon and get those over.
Oh, no, he sent those as well. I can actually just, okay, that's fine.
Okay, all right. If you guys have them, we're good.
Yeah, no, I'm all set.
Okay.
Super. Well, thank you all very much if there's nothing else. And we'll be adjourned.
All right.